what do you have for me?
Okay, see these pictures.
Oh,
This is a mommy makeover gone
wrong.
very wrong.
Yeah, I can see that here.
So look at the breasts. There's no nipples. There's lots of scars.
That's not a nipple?
No, it's not a nipple. It looks like she's had necrosis. It looks like she lost abdominal skin.
Oh,
This is not acceptable.
Will you please send in Mary?
Ah, Mary.
Mary?
Hello.
Hi, Dr. Nassif.
I'm Mary.
Hi, Mary. Terry Dubrow. Pleasure
Hi.
to meet you.
What was done to me was incredibly devastating, and I would never wish that on my worst enemy. Every time I look in the mirror, I cry. It's a very sad, depressing, deformed body I see. Me and my husband have 3 kids together, one 16-year-old, 15-year-old, and a 5-year-old. And from having 3 C-sections, you have that fupa, and it doesn't matter how many sit-ups you do, that fupa will not go anywhere. So I wanted a mommy makeover, and I experienced problems immediately. So the very next day, my nipples were already turning black. That's when everything just went downhill. It just kept on getting worse. I had emergency surgery, and after I wake up, I'm just in tears. I look down, I see my stomach and how deep it is in the hole. This is my scar, and it looks like somebody who wears their pants underneath their belly. And then I see that I have no nipples, and it makes me feel sad, depressed, and less of a woman. This one's the worst. It's the one with the most infection, and there's no nipples, there's no breast. Like I have to wear a push-up bra just to try to get a little bit of leverage. I won't let my husband touch me. I won't let him look at me because I don't want anybody to see it, period. It's embarrassing. I want to see a pretty body. Somebody that'll be like, dang, that type of thing. That's what I want.
So, Mary.
Yes.
We've seen your pictures. How did a mommy makeover go so south on us?
Well, let's start from the beginning. I had gastric bypass in 2019, and I
Okay.
lost over 150 pounds. So I took my husband with me. We went to Matamoros, Mexico. They're going to do a tummy tuck,
Right.
and then they're going to do a breast lift.
No implants, just a lift?
Correct. That was
Okay.
the original plan. And then they told me when they do the breast lift that I'll go down to an A. Well, they were talking to my husband in Spanish.
Did your husband speak Spanish?
Yes.
Oh, he does?
That's why I took him with me. He told them to do the implants.
Did he tell you he told him?
Nope.
Ooh, wow.
Can you imagine what my wife would do to me
No,
if
she'd
I
cut
did
off your
some-
huevos. I'm sure your husband taught you what that word means.
After having big boobs all your life, you really don't want big boobs. You just, it's much nicer to have smaller boobs. But the next morning, I realized that my breasts were more than just lifted. I was bigger than a triple D. I started questioning my husband. I'm like, well, what is this? And that's when he told me that they did implants because he didn't want me to be an A. He loved my natural triple Ds, and he wanted me to stay big.
Okay, so the plan changed right before surgery.
Right. We're in surgery, and I woke up when they were working on the left breast. In the background, they were playing Selena, Kuma La Flor. I felt everything.
Wow.
He put more stuff in my IV. I went back to sleep.
How long did the surgery take, do you know?
Well, it started at 5 o'clock, and I don't think we got done until midnight.
The end of the day.
Yes.
Okay, a lot of red flags here.
But by the next day, my nipples were turning black.
Wow, that's fast.
Yes.
If your nipples start to die that early, you know what the underlying tissue is also doing?
Dying.
Dying.
The doctor in Mexico came to our hotel, and she said I need to drink more protein and eat more pineapple.
Oh, that's gonna save the nipples.
Yeah.
What Mary went through is so horrific. When she suffered a disruption of her blood supply, leading to a compromise of circulation to her nipples, the surgeon should have immediately started countermeasures, meaning put on nitro paste, use leeches, take the pressure off, take the implants out, remove the sutures, absolutely everything and anything.
So I stayed there in Mexico for like 4 to 5 days, and then we went back to Houston, and within 2 weeks, the incision down here started coming open, and I was bleeding everywhere. We had to put duct tape on it. My stomach was already opened all the way up. Blood was coming out of both breasts.
I actually went over for her kid's birthday party. Somebody said, come look at this and see what Mary needs to do. And I went back there and I looked at it. I said, Mary, you need to go to the hospital.
Really? You saw it?
Yes. And the next day I had emergency surgery.
To cut out the dead tissue and remove the implants?
Yes,
Really?
I woke up after the surgery and I was in tears because I had lost my breasts, I had lost my nipples, and I had a hole in my stomach that big.
Wow.
And it was probably about that thick.
What percent did the implants really do to kill her nipples?
Probably a lot. The implants do cut off 80% of the blood supply to the nipple.
Yeah.
It's true. So it makes it a lot riskier. By the way, what did you say to your husband about the whole "you didn't tell me" thing?
I blame him for everything.
But you guys are okay, yeah? Oh, really?
But you know, we have 3 kids together, and
If you were to fix this, it would help your situation, maybe, hopefully?
maybe there's potential.
I'm sure you want something done to both the breast and the abdomen, right?
I want it all fixed if I can.
You want it all fixed?
Yes.
You're taking on a big hit, potentially, physically, risk-wise, emotionally, and all that. Okay.
All right.
Well, there's something about Mary.
Still one of the best movies of all time.
Very funny movie,
Do you
right?
even know what that movie
Did you
is?
see it?
Yes, I've
You've seen it?
Of course.
You have a little gel in your hair.
Yeah.
Jill? Stand up for a second. And let's first of all look at the amount of soft tissue thickness you have in the chest area, right?
Okay.
All right. So the good news is you do have some soft tissue thickness, meaning you have breast tissue.
Okay.
But the only way to give you what I call a projection to width balance is you need something in there, and you have to have breast implants.
I just want them fuller. I want them to look
Yeah.
normal, not like this. That's
Right.
hideous.
So potentially one could put an implant in
Okay.
and then maybe later make nipples. But the challenge is that the skin's been really stretched.
Right.
You have a lot of lax tissue on the sides, which affects the way the overall chest will look. And here, you obviously lost all this tissue. It's pulled everything up. But you do have some laxity. The question is, does one need to make an incision this way to tighten this? So that's a possibility. But it's a high-risk possibility. I mean, if you thought you were high risk before, you're 10 times the risk
I got
now.
faith.
Mary's skin was very stretched out by the previous weight loss. When that happens, it has a much greater risk for complications from surgery, not the least of which is a reduction of blood supply and actual soft tissue necrosis or death.
There are some serious, significant cardiovascular issues that could always occur,
Oh, yeah.
you know, with your lungs and clots and all kinds of things. So it is risky surgery no matter what.
Definitely worth the risk.
Can't scare you out of doing it.
I have my mindset. I've already lost everything, so even if they do the surgery and it doesn't take, I don't have anything to lose.
She's already had to deal with that, and it may happen again.
If you're in, I'm in.
I'm in.
Okay.
And I'm your cheerleader by the side.
Thank you.
By the way, just to add to that, he actually was a cheerleader.
For real?
For real. Take your pom-toms, and say, "Go, Mary."
We'll do it together. M-A-R-Y.
Give me an M. L-E-T-S-G-O.
What?
Let's go.
Color outside the lines, go ahead and try. Don't rush a single thing, just take your time.
Are you excited, Mary?
I'm extremely excited. I'm nervous. I'm scared.
You didn't sleep much last night, though, did you?
No, I didn't sleep at all. My husband is on my mind today. None of this would have ever happened had he done what he done in Mexico. I'm hoping and praying one day I can find in my heart to forgive him. And today is going to be the first step.
Mary, how are you?
Good, and you?
Good to see you. You know Heidi.
How are you?
Good, and you?
Good.
I want to get right to it because we need to get into the operating room because, to be honest with you, we have a lot of work to do, but we have a couple of issues. The question mark for you is, do we need breast implants? Of course we do. How big should they be, right?
Right.
So once we get into the operating room, I know you don't want to be too big. You want to be somewhere in the C range, but we need to have that balance between projection and width, right? And then the other big issue, of course, is with your abdomen.
Yes.
Now, do me a favor, come over here for a second. Here's the big issue. We know we're going to be tightening in the vertical direction. The question is, do we need to tighten in the horizontal direction? That's TBD, as my wife would say, to be determined, okay? This is going to be a long operation, a lot of work to do. I'd really rather not make a vertical incision right across our abdomen. It's always better to be on the beach without any visible scars. And if I can do that for Mary, I really want to make that happen. For Mary's surgery today, I'll start by making an incision along her inframammary crease, assess the pocket, and insert a pair of implants. Then I'll perform a breast lift by removing the loose skin to tighten the breast envelope and the surrounding tissue near her armpits. Next, I'll make a horizontal incision across her lower abdomen, followed by a potential vertical incision, and remove the excess scar and skin. Finally, I will pull the belly button through before closing her up. After she heals, she will get areolar tattoos.
No allergies, 2 grams of Nassif.
Yes.
Thank you.
So assume they put the nipple right here. This would have been 8 centimeters. Okay, so we're gonna make a submuscular pocket and then try on some implants. Do me a favor, would you get me a sort of 400-ish higher profile implant? 405 boost, let's do it. All right, put this in. Here we go. Let's close the pocket. That seems to be the right size. That's gonna give her a sort of a small D, which will go with her body type. Let's do the other side. Submuscular space is preserved, that's good.
Sats dropped for some reason.
What?
Her sats just dropped for some
did?
reason. Yeah.
Really?
Yeah.
Why don't you guys step out? Is she intubated?
She's intubated.
Holy fuck. Shit. Endotracheal tube secured?
Yep.
Good.
I just went to 100% oxygen right now.
Many times the vital signs fluctuate during surgery, but Mary has dropped her oxygen saturation. That is one of the most significant and scary things that can happen. So it's important that we stop the surgery immediately, remain calm, and figure this shit out.
I'm giving her some bigger breaths now.
How's her CO2?
CO2 is fine. Her pressure is fine. Now she's stable.
Okay, good. Even once it's resolved, it can keep you on edge for the rest of the operation. So although I have a lot of work left to do, I'm frankly a little bit anxious. She doing okay?
She's fine.
All right, we got the pocket made. Let's put the implant in. Okay, good. All right, let's close up that pocket. Okay, implants are in. Now we're gonna tighten the envelope. Looks good. Okay, let's tighten the other side. Bye-bye. All right, staple it. All right, finish the breast. Let's start with the abdomen. First things first, let's cut this tissue out. This represents how much tissue died. She lost the entire lower abdominal area. So look at this. They sewed up her abdominal wall with staples.
No.
They did.
Oh my
Wow, they
goodness.
stapled her abdominal wall. Wow.
Who does that though?
Mexico, I guess. Okay. Oh, that's tight. That does not need a vertical.
No.
That's good.
Yeah.
All right, let's bring the belly button out and close this up, okay? That was difficult. That was the most work I've done in a long time, but very successful. Hopefully, we don't have any complications. This could change her life forever, and that's what the goal is.
Hello. How are you? You got that look on your
she has
face.
that look.
You got that.
She
Hi,
has that
Mom.
look. It's
hurting.
How are you?
Doing good.
But you know, overall, though, I'm saying she looks good. Looks rosy,
good.
and
I mean, the freckles are normal.
I mean, we got the eyelashes going.
Oh, the eyelashes, yeah, of course.
How do you feel?
I'm hurting, but I can't wait to see what it looks like.
Long operation. Feeling okay to stand up?
I mean, I can stand up, it just hurts, but it's part of it.
Once
If
she
you don't
gets
mind.
up.
Once you get up, you're okay? Want
Yeah.
a little help?
Yeah, that's all she needs. She's good.
Let's take this.
I can tell you did a real good tummy tuck with that posture of hers.
I know, right? Yeah.
When you have this posture, you know it's good.
All right, why don't you sit down? Let her sit back.
Oh, wow.
Check that out.
Nice. Great.
So, look at the size,
They're full. They don't have a dent no more.
right?
So much better.
They don't look too big, do they?
No. Seeing my stomach and my breast for the first time today was very exciting. I mean, of course I'm swelling, but once it goes down, it's gonna be beautiful.
I removed all the excess skin and I went all the way back here. Imagine how much sewing there was.
That's a lot of sewing.
I probably put 300, 400 stitches in you.
Wow.
And we got to keep an eye on you for any possible complications. We're not out of the woods yet. There's a lot of things that can go sideways on us. Yeah. All right.
Nice seeing you guys.
Good seeing you
recover?
guys. Thank
My
you.
pleasure. And we'll keep a
Thank
close
you.
eye on
Took
you.
care of
Thank
her
you.
perfect.
So far, so good. Thank you.
After my mommy makeover in Mexico, after my husband told them to give me implants without my permission, I looked very deformed. I had small hanging sacs as breasts with no nipples and a hideous scar across my stomach. Now after having surgery with Dr. Dubrow, I feel super sexy and I love myself now.
Look up at the sun, 'cause it's shining for you. It's a beautiful day.
How are you feeling?
I feel more like a woman. I feel whole again. I feel more feminine.
You look amazing.
Thank you. A couple of weeks ago, we went to the company party, and I was actually able to wear a two-piece for the first time.
How was that?
It was nice. I didn't have the extra skin. I didn't have the scar. I actually had some boobs. And before my surgery with Dr. Dubrow, looking at myself in the mirror, it was a sad, depressing situation. I would cry at times just looking at myself. My breasts were hideous. And now that Dr. Dubrow worked his magic on me, it is amazing. I have breasts and I have nipples. The scar is gone and I'm flat. I don't have no extra skin on the front anymore. And I'm just like, dang, is that really me? When I went for them to do the 3D tattoo of the nipples, it kind of hurt. It was my first tattoo ever. I don't do tattoos. I never thought in a million years I would ever get a tattoo. When I saw it the first time, I was just in shock. Oh my God. You look in yourself in the mirror and you see it and you're like, oh my God, that does look so real. I was at my worst because that was horrible to go through what I went through. I would
Yes.
never wish that on anybody.
No, it's good to see the life back in you.
Yes, it's been amazing.
I would get messages from my aunt saying, Becca, check on your cousin, check on Mary, because she's not doing good. And seeing her overcome that darkness, seeing her happy again, as her cousin, as somebody who loves her, it's overwhelming.
How about you say we go ahead and get on these things?
All right, TTR, time to ride.
Hell yeah. My marriage has still been quite rocky. I have not stopped blaming my husband for what he has caused. It's a work in progress. But my future now looks much better. Now that I have the body that I want, I finally love myself above and beyond expectations. Woohoo!
So let me tell you about this patient. This is a really challenging patient for many reasons. Let me show you this. What's your first impression when I show you this photo?
Okay, so those are big capsular contractions where the breasts are way up and the implants are way low.
Yeah, she's got very weird contour irregularity.
But now this is adding another layer of complexity.
I've had one breast augmentation and I was left with brick-looking, saggy breasts that are plain and ugly to look at. Before my surgery, I was super confident in my body. I was always in a bikini. I was going to resorts that were topless. I never felt like I had to hide myself away from anybody, but I always wanted to enhance my look and have fake-looking boobs.
Hi.
Hello.
Let me know if you need help with anything.
Thank you.
Thank you so much.
Now, since this breast augmentation, it's completely changed. I don't show anybody my breasts now.
I mean, I remember the doctor, like, when he took the bandage off, I thought, okay, maybe it takes time.
And I gave time, and 2
Almost
years
been 2
down
years.
the road, I
Yeah.
was like, okay, maybe 2 years they're gonna be better, but that has not happened.
No.
So I'm coming to Dr. Dubrow and Dr. Nassif in hopes that they can make me feel confident like I used to and make something very ugly look normal.
Cherish.
Hello.
Hello.
Hi.
Cherish?
Cherish.
Hi.
Nice to meet you.
Cherish.
Yes, Cherish.
Say it one more time.
Cherish the moment.
Cherish the moment.
Yeah.
Cherish.
I'm Mandy.
Mandy, hi, Dr. Nassif. Will you actually clean out my ears for me? Just trim that hair.
Oh, how can you hear anything? Where did you come in from?
Bakersfield, California.
Okay, so you guys are friends, obviously.
Yes, best friends.
Best friends. So what made you want to do breast augmentation?
I wanted porn star boobies.
Like a double D or a big double D kind of thing. Before surgery, what size were your breasts?
Probably like a full B. I always had boobs.
Because you only have 600 cc implants in here,
Yeah.
right? I mean, not only, those are big, but that's, but not as big as what I would expect.
Yeah, so I was like, go big, go home, just fill me up, make me look good. And I went with a girlfriend, so we got it done the same day together.
Right.
And she took care of both of us.
So how did it go?
Surgery, from what I understood, went great. 2 days later, we went back and they took it off, and I just started bawling.
Why?
They were horrifying. They were like bricks, like in my chest, like all the way up to my collarbone.
Yeah.
All the way down to my rib cage, and it's like rectangled.
So what did the doctor tell you when you said, hey, what's with the high breast implants?
They're fine.
They'll drop in.
They're gonna drop.
I'm surprised you didn't say the classic, they'll drop in, come back in, let's see, I'm gonna retire in 3 years. Come back in 4 years.
Right?
That's a thing. We call those doctors GOMOs, get out of my office. And unfortunately, I see a lot of those doctors treating a lot of different patients. So they never looked good.
No, they were never. They were scary from the very get-go.
So you've seen them progress and go through their phases.
I have. I mean, she was always so free around me. Obviously, I'd seen her before her enhancement surgery with no top on.
And they were good, I bet.
Yeah,
Just a little deflated up here, right?
Yeah, no, they were perfect. It's just that she felt like she said, her chest was just longer, so she wanted to fill up the top part a little bit.
Where's your head at right now? Do you think you want breast implants, just smaller ones?
Oh yeah, I am a 32H.
Right.
I'd be very happy with 350, even 400. I just want them a little higher and normal shape.
I'm not exactly sure what's even possible because you have some features that indicate there's some high-risk components to your possible surgery. All right, so let's have a look.
You ready?
Yeah, open these up. Cherish, do me a favor.
Yes.
Put your hands on your hips and push. Look at this. Look at that superior displacement.
So this is all sitting above the muscle?
Yeah. So this is what's called an animation deformity. When you animate and it makes it look unusual, the muscle wasn't released completely. Even at rest, they're just too high. So,
well, I wouldn't mind them being up here if this part was also up here.
Right. What you have is the classic dissociation. They're not together. They're dissociated, okay? And they need to get together somehow.
That's the part where I can feel the bag, and when I even lean forward, it's like...
Right. And let's see how big the scar is. That is a gigantic scar. So it looks like you won the Complication breast lottery. You've got it all.
Yeah.
You know, they're too big, they're not shaped properly, and then you also have the super weird contour.
I'm jacked up.
Well, I would, yeah, no, and he's jacked up.
He has nice eyebrows. I was just admiring your eyebrows.
Oh my, by the way, do you know how many hours have gone into making those eyebrows from?
You had them tattooed?
I had a little microblading. I've gotten complimented on my eyebrows many times.
Yeah, by the way. You know what I love about your eyebrows?
Nothing.
Nothing.
Yeah, I knew it.
I think you know this is a high-risk surgery to begin with, right? Because all these things have gone badly. How do we fix all this? We would take the implants out, remove some scar tissue, release the muscle, tighten the pocket a little bit, and if you're gonna use a smaller implant, you're gonna have a lot of loose skin, so we have to tighten the skin. So, what do you think about the possibility of new scars around your areola and down like this?
If my boobs were symmetrical and up sitting nice, I would be
acceptable.
Oh, yes.
You need this surgery. You're having a giant problem with your breast implants, and I think I can help you.
I'm putting my boobs in your hands.
Okay.
Literally.
Yes.
It's surgery day.
No, I'm so excited.
I'm so excited too. Let's do this.
The challenge here is to determine what's going on the inside of Cherish's breast pockets, because there's got to be something abnormal to cause this much distortion. I've never seen anything like this from a simple breast augmentation. There's something going on, and I need to find out. For Cherish's surgery today, I'll begin by making an incision along her inframammary crease and remove her implants. Next, I'll release the muscle and then stitch it down to reestablish her breast pocket. I will then insert smaller implants and perform a mastopexy to reduce the size of her skin envelope. And finally, I'll move her nipples up so they're in the center of her breast mound. I didn't really notice this before because there were so many other complications, but when you look at it, she has full-blown symastia.
Congratulations, she has them all.
She has every single one.
Every complication.
She isn't just a few of the chapters in the textbook, she's the entire book. Cherish not only has all these difficult problems to fix, but she has one of the worst, which is called symastia, where there's a connection between the right breast pocket and the left breast pocket overlying the breastbone. This now adds a completely another level of complexity. Okay, so it's a 600 cc implant. So here's an intact implant. All right, let's take a peek. The muscle was not very released. It's 100% submuscular. So when she contracts, it just pushes this up. It's also way over dissected onto the chest wall back here. So even for a very big implant, the pocket should be here, but the pocket is here. So that introduces a unique challenge to close down the pocket. So right now I'm gonna use Cherish's chest wall muscle to fix multiple problems. As I release the muscle, that'll fix the animation deformity. As I rotate it down to create walls in the center of the chest, that'll fix the symastia problem. And then finally, I'm gonna use that same muscle to build the wall on the outside to prevent the implant from going into the armpit. Let's have the implant, please.
375.
A 375. She's gonna love this size. Now we have to reduce the size of the breast envelope. There's gonna be a lot of skin to remove here, jeez. That's a lot of skin. Look at that. This is where it gets really dangerous. You gotta release this tissue so that you can get the nipple to move up. But the more you release, the less blood supply. So we reestablished the right pocket dimension, put a smaller implant in, released the muscle, tightened up the skin envelope, raised the nipple. Okay, let's go over to the left side. Still has symastia, look, still has symastia on this side, look at this. I'm cautiously optimistic. I think this went extraordinarily well for a very difficult case. Okay, let's sit her up. Let's see if there's some at track. Wow, that's pretty good. It's like Bel Air and Beverly Hills adjacent.
So stupid.
You know what I'm saying? This is a really good result. I think she's gonna cherish this, I really do.
Hello, hello. How are you guys?
Good, how are you?
Nice to see you. Hello.
Hi, how are you?
You look good.
I feel good.
Yeah, look at it.
You feel good?
I feel really good.
Got a lot of color in your face.
Yeah.
I feel amazing.
So let's take a look. This is gonna be just a peek. We hope it's not a shrieking peek.
Let's see what we got. I'm excited.
This is the Are They Alive check. It burns. I did a lot of work on these.
I'm sure you did.
Oh, look pretty good.
It's looking amazing.
Ah, pink. Okay, that's pink and beautiful. I'll take that.
Yay.
This one is
Pink.
pink, thank God. Holy moly, okay.
Hey, there you go.
Goodness.
These are really good. And you can see they're really full. Are you all right?
I
Oh,
love them.
You do?
Yeah. I'm sorry.
You've been through a lot with these, huh?
Yeah. Thank you so much.
You're welcome.
I finally have the breasts of my dreams. I no longer have to worry about how they look. I'm just full of so many emotions. I'm very, very thankful.
everything is corrected.
Everything right now is corrected.
Take good care of her.
Congratulations.
Thank you guys.
You're welcome.
Thank you so much.
Seeing you.
Thank you so much.
Congratulations.
I'm very glad I put my boobs in Dr. Dubrow's hands because he excelled in making them better. Looking back after everything I went through with my failed breast augmentation, it feels like it was another life. To finally not have the completely misshaped breasts, feels incredible.
Let's go under the cameras and lights. Let's go.
Beautiful day.
Absolutely gorgeous.
And look at you. Oh my gosh.
I feel amazing. You look fabulous. The last time I've seen you in a bikini, I think, was 2019 in Las Vegas. We need to go back to Vegas, swimsuit.
You actually have that glow back to you.
Finally.
Yes,
It took a while. It feels exciting each day, getting up, getting dressed. It's like a new present. Just love them every day. I have a weight lifted off my shoulders and my chest.
They're so much better than what I thought they could be. Honestly, I thought there was no hope.
I was hopeless for a moment.
This is the breast augmentation Cherish should have had the very first time. Seeing her so happy with the results from this surgery is awesome.
It looks like Cherish. It enhances her in the best way.
This is the Cherish that I remember meeting, loving herself, just feeling so comfortable in her own skin.
But I'm back. I feel good. The girls feel good. Before my surgery, I had brick-looking, saggy breasts. My implants were super high and my breast tissue hung off them. I went from being able to show my breasts to locking them away. I love my boobs now. The future for me looks like more bikini trips, more just feeling good about myself. Look out, world, these girls are now free. The sun is out. Yes. Let's let the girls out. Yeah. I am definitely cherishing every moment thanks to Dr. Dubrow and Dr. Nassif, and I am so thankful. They're awesome.
It is so nice out today.
Well, after parking a mile away, you do anything to get our steps in.
It's healthy for us to exercise.
This is cute.
I need to find some shirts. I'm thinking something that is going to hide my chest a bit.
Okay.
My chest looks like 2 empty soup bowls. It's almost like I had a mastectomy after 4 failed surgeries. I'm really hoping that I can get a 5th surgery with the world's best. Hey, what about this one?
The pink is good.
My childhood was different. I had man boobs back then, as everybody pointed out. A lot of kids would walk through the halls, they would call me the Pillsbury Doughboy. Being as rough as it was, my weight also continued to rise. At my heaviest, I was 350 pounds. I realized that I had to make a change, and I did.
Just hop on a gazelle, you can do it!
There was the Tony Little Fitness Gazelle back then. Everybody in the neighborhood could hear when I was on that machine, which was pretty much morning, noon, and night. So with my dramatic weight loss came a lot of issues with my skin. My chest, which looked like a full CD cup for most females, now were deflated. My skin around my stomach was really loose. So September 2021, I finally have my surgery. Should have been a point of celebration, but it wasn't. Everything was wrong.
So do you have to wear the shapewear
It depends on the
underneath?
time of year. Like in the summer, I sweat to death in my shapewear. So the problem is I will then start sweating under here because there's styrofoam in here.
Okay. Well, then try it without.
Shapewear is a last resort for me to feel somewhat normal. It's got 2 fake pillow-like pectoral muscles that go where my chest used to be. I don't love that I have to wear it, but I don't feel confident without it. Ready for disappointment?
It's not disappointing.
It is disappointing. Look, see here, like up here looks fine.
Well, for right now, the cut looks okay, but then if it shrinks, it might look more
It's going to shrink. Everything shrinks.
okay.
When I stand in front of the mirror, I'm still mortified that after all these years of weight loss and surgeries, I look like a patchwork quilt. I'm hoping that Dr. Dubrow and Dr. Nassif can put this back together again.
Got my eyes on you. Everybody watching, so tell me now, are you ready for this?
Oh, Dr. Zabra.
Hey, check this out. This is a gentleman named Bruce, okay? Bruce lost a lot of weight and had weight loss procedures, including gynecomastia surgery, right? What's the big thing with gynecomastia surgery that you want to avoid?
Yeah, taking too much, and then you get that saucering.
I would call this salad bowling. Look at this. This is Bruce.
Oh my God.
If we're gonna tackle this, and this is a big if, because if a saucer is not fixable, what's a salad bowl?
You could do your reverse tummy tuck thing. Oh.
This is exactly where I'm going.
Okay, hold on. So you do this and you move it over here. Can you do this and move it up here? If there's any tissue.
No matter what everyone says about you, you're
Thank
not
you.
that stupid. You really aren't.
Thank you. It's good to be good looking and kind of smart.
Okay, now you lost me. Let's go see him.
Hello.
Hey.
Hello.
How are you?
Good.
Good, how are you?
Nice to meet you.
Dr. Nassif.
Kara.
Bruce.
What's the relationship?
We have been friends for 25 years.
Wow.
Yes.
That's kind of like, you know what?
Almost like us.
Our love story started 25 years ago. My sister and my mother introduced me to him, and we're still going strong.
Was that disgusting? Oh, no, that was... You've had some weight loss procedures, so you obviously had gained a lot of weight because you look great now.
Thank you. So I was big as a child. For prom, I was right at around 350 pounds.
How tall are you?
5'7".
Wow.
But that was the turning point where I was like, I can't do this anymore. Like, this has to change.
That's about when you started hitting the gym daily.
All right, so you really got it together and you lost the weight.
Got it together, lost the weight. I had a lot of skin. I think from the first surgery, it was around 16 pounds of skin altogether that was removed.
16 pounds of skin.
Correct.
Wow.
And my chest, although it looked better, it was still really fatty and it still looked like female breasts.
Okay. Gynecomastia surgery is basically surgery on a male to reduce enlarged breasts. It may seem very basic and very easy, but in fact, it's much more complex. You need to leave just enough underneath the nipple so it doesn't crater, but not leave too much so that it doesn't look feminine.
It was about 4 to 6 months after that we
Perfect.
did the surgery. There's now craters in my chest cavity. I look deformed. What can we do? Bruce, don't worry about it. We're gonna do a fat transfer. We'll fill it back in, not gonna be a big deal. So they made me gain 10 pounds. They took it right from my back area.
Did it look improved at all?
They were a little more full, but they were lopsided. They were lumpy. And within 3 to 4 days, they were gone.
3 to 4 days?
3 to 4 days.
And he wanted to do it again?
Yeah, the fat disappeared in 3 to 4 days.
It was completely gone. Like the surgery never happened. He goes, we're gonna have to do this again. I need you to gain 15 pounds because it's not enough fat. We didn't put enough in. After 40 years of what I went through, I didn't want to do that. It was horrific to me. I'm now gaining weight and stretching out the tummy tuck I just got. So he did the fat transfer, didn't take, it was still lumpy.
Surgery number 4 now, right?
Correct. So doctor scheduled a 5th surgery or 5th fat transfer.
Okay.
Went home and talked to Kara, talked to my sister, in which all of my friends and family were like, have you lost your mind?
Definition of insanity.
Yes, doing the same thing over and over again and getting the same results.
Yeah, expecting a different result.
What are your expectations?
My expectations are to hopefully look a little bit better than it does now.
Even if we could come up with a solution, it's still gonna be high risk. It's gonna maybe require 1 or 2 or 3 or more procedures to get it where it's acceptable, and the whole thing could fail.
Hello.
Hi.
The anticipation is killing me. I want to see this.
Okay. Oh, let's stand now. All right, do me a favor. First,
look at this.
Yeah.
This guy's...
You know, your fitness has, in a way, made this harder.
Yeah.
Because your hypertrophy made your upper pec muscles larger. So now it exaggerates the concavity you have.
I thought that I could stupidly build muscle and make it somehow grow. So I was able to build muscle up here, but...
Boy, it's interesting, Bruce, because they didn't just do gynecomastia surgery. They basically took it all. I mean, it's gone. All of the volume is gone. All right, have a seat for a second. So there's really only 2 options. Option 1 is to design a pec implant. I'm not a huge fan of pec implants because they tend to have some significant complications. So the second possibility, the preferred one for me, is always to use your own tissue if possible. You do have a whole section of tissue right here, that we could theoretically take this skin off, and your stomach would look better anyway with a little bit of a reverse tummy tuck. Take this, fold it out on itself, and put it in here. First of all, look how your stomach looks.
Much better.
That would potentially work. Have I ever done that? I've never done that. I've done it in other areas.
Hello.
Look, no one wants to invent a surgical procedure on someone. But sometimes you got to use well-established surgical principles to find unique solutions to very difficult problems. And when you do it, you better be fucking good at it. It's a natural tissue approach. It's based on a good principle, but it's never been done.
You guys are the best. You know what you're doing, and I trust you, and I think that makes the most sense.
I think we got a plan.
I think we got a plan, my man.
Perfect.
Here we go now. Here we go now. You know I'm coming back better than ever.
Are you ready for this?
So ready.
Bruce.
Hi.
You're in a unique situation. You won't find this in any textbook or any literature article or anywhere because there really isn't many solutions. Sit up and let's go over this. I want to show Heidi this. So, Bruce had 4 previous operations. The last 2, obviously, they took too much tissue. What % improvement do you think you actually would be happy with, honestly?
So 5% would anything better than this.
Do you love this guy?
Yeah.
Today for Bruce's surgery, I'll start by making an incision along the lower part of the chest and elevate up a flap of tissue. I'll then make a pocket underneath the flap, remove the skin, and pull the tissue up from his abdomen into the pocket to fill the concavity. I will then stitch the tissue into place and tighten the skin around the breast tissue envelope to give Bruce a good chest shape. All right, we're basing this whole operation on the concept of reverse tummy tuck, so we'll start by making an incision and see what we can do in terms of elevating this area. Okay, so we've elevated up the flap. We can take this skin off and theoretically put this under there and provide volume to the lower part of the chest where it's concave. So now we'll make a pocket underneath the concavity to put this into. In order to maximally reconstruct Bruce's chest area, you have to rotate and layer fat from areas where there's too much fat into areas where there's not enough fat. Okay, so we've basically draped this entire advancement flap on the lower part of the pectoralis muscle that's in the middle of the chest. So I'm folding back some of the breast tissue in where the upper and lower chest is overlapping. Boy, is this a unique solution I've never tried. Sure hope it works. I mean, this was sort of my visualized plan, was to suspend this flap to the pec muscle. All right, well, we certainly achieved volume filling, right? Now we have to tighten the skin a little bit. Bruce's skin has lost its fundamental internal integrity. Just like fabric does, if you stretch it out like an old stretched out t-shirt, you can't tailor it. This is a big areola. We could make it smaller. That would tighten some of the skin around it. It's really hard to know how much to tailor it at the time of the operation because what is initially just the right amount of tautness, a few minutes later is loose again. So you have to keep taking tissue till you get to the point where it seems like the edges are kissing and it's gonna look appropriately tightened. Okay, that seemed to work, Let's try the other side. Let's see if we get a little second side phenomenon with this. I hope this works. This guy's such a good dude.
Yeah, very sweet.
Very sweet. Like me.
Uh-huh.
All right, so let's lift up the upper part and create the pocket. Ah, that's interesting. Oh, that's part of why that muscle looks so big up there. It's fat. They took too much from the lower and didn't take the same amount from the upper, right? Well, that totally makes sense. What I thought was an abnormal muscle in the upper part of his chest is really a normal muscle with an abnormal amount of fat overlying it. That has been made to look worse because the previous surgeon took so much of the fat in the lower chest, it gives the illusion of too much muscle in the upper chest. I mean, doesn't that look fixed? It's completely different than I thought it was gonna be. I didn't really realize that till 3/4 of the way into it. Not only did I have to bring fullness into the lower breast, I had to de-fat the upper breast. All right, let's sit him up. I think this worked, didn't it? We got rid of the hollow. We tighten the skin, the crease is pulled up. Yeah, this is working. All right, let's put him down and close. The most difficult thing about knowing where we're really at with Bruce's surgery is that because the skin has been so stretched, you really won't know what it really truly is going to look like till he stands up in the post-operative period. So although it looks pretty good sitting up and even lying down, I actually don't know how much of an improvement it will be.
Did you miss me already?
I missed you desperately. How are you? Kara, how are you? Nice to see you again.
Good to see you too.
How do you feel?
Like an Amtrak ran over my chest.
Yeah, that's me. I mean, you basically had an upside down tummy tuck. You should probably stand up if you don't mind. All right, so I'm hoping the nipples are alive. Okay, there we go.
Oh, cool.
That side profile is awesome.
Look how tight this is.
What awesome.
Isn't that what a male chest looks like?
So awesome. Dr. Dubrow did not do 5%. He did like 85%. This looks fantastic. I'm so excited for the swelling to go down and to see what it really is going to look like when it's done, but totally mind blown. You're amazing. Thank you so much.
I'm sorry, what'd you say?
You're amazing.
What? No, I'm kidding.
You're amazing.
Oh, thank you.
It's a new day. It's a new day.
It's been a long journey. 4 procedures of going under and preparing, gaining weight and losing weight and fat transfer. You start to feel like, what was the point of any of it? It's not just your boobs that are deflated, it's your hope altogether. But now that I have my new body, I couldn't be happier.
It's a new day. Say goodbye to the past. These good times were made to last.
Before my surgery with Dr. Dubrow, my chest looked like 2 saucers you could fill with water. It was sunken in, I wore shapewear to hide my deformity, and it made me feel sad. I clearly still have scars that are healing, and they will in time slowly start to dissipate. But I know that I look great. The saucers are gone. I finally have a body I'm proud of, and the guys I'm fucking are way hotter than they used to be. Always really appreciate when you carve time out to come to the gym with me, which is so nice to be back here.
Without your Spanx?
If you remember that? Oh. Oh, good times. It's just great to be able to be back in the gym, be able doing my thing, being able to really feel energized, to be able to inspire other people. I have a small following.
That's why you should be a personal trainer. It's an inspiring story. Everything you've done with health and fitness over the last couple decades and losing the weight, you'd be a really good personal trainer.
I'm getting my certification to be a trainer, and I feel that anything is possible, and that's huge, and that's a win. And I am so deeply grateful for Dr. Dubrow and for the team of people that helped make this happen. You ready to go kick some ass?
Yeah, let's go do it.
So as you can see, the left side is up a lot higher than the right.
My name is Rebecca, and I went from boobless Becky to butchered Becky. One failed surgery left me with one breast going north and one breast going south. I've got this freak show that I'm completely embarrassed of. When I was 17, I had my first child, and about a year later, I had my second. My body started changing after each child, and by the time I had, a total of 5 children, my breasts had really taken, a lot of stretching. They pretty much looked what I call it to be sock titties. Looks like you have a bunch of coins thrown in a sock and they just hang down. So in 2003, I had breast augmentation, and immediately they were 2 different looking boobs. We didn't have any money. So I knew fixing it was not gonna be an option. I was gonna have to live with it. My ex used all of my insecurities against me. And he'd say, nobody's gonna want you like that. Nobody's gonna want you the way you look. It put me in a very dark place, very dark place. I had no hope at all. But after 25 years, I left my ex. I decided to tell my best friend the truth about everything. So she offered to let me stay with her till I got on my feet. First and foremost, I needed to find a way to support myself. And so I was able to find that way through 3D areola tattooing for cancer patients, for women who have any type of problems with, not having areolas or need touch-ups or scars. And then shortly after that, I ran into my first love in high school. We made eye contact, and we haven't been separated since.
Hey, honey, brought you some lunch.
Thank you.
And a coffee.
I am so emotionally strong. I am physically strong. You know, I feel like I'm thriving in my business. Like everything is A1. Thank you. I love you. Nothing could be more perfect. The one thing that is holding me back from feeling whole is my breasts. I was able to get that consultation with Dr. Dubrow and Dr. Nassif today.
The Dr. Dubrow and Nassif? Wow. You deserve it.
I'm tired of feeling like a freak, you know? I'm tired of faking the funk.
And I don't want you turning off the lights anymore after this, right? Give me some nice dun-dun-duns. Great.
This surgery would just be my cherry on top of my life sundae. It will make everything perfect. It will complete me.
So what do we have today?
This patient, her name is Rebecca. Rebecca has a breast situation that has been complicated by not only plastic surgery, but by significant weight loss. As you can see, the left side has significant capsular contraction.
going
The
out.
right side has the opposite problem. We've got a bottoming out with weakening of the tissues. And then the breast envelope is completely loose.
Can you please send in Rebecca?
Aha.
Rebecca, hi, Dr. Nassif.
Hi, nice to meet you.
Rebecca, Terry Dubrow, pleasure to meet you.
Anthony Matthews.
Nice to meet you.
Anthony
Welcome.
Matthews.
So where did you come in from?
Bakersfield, California.
Okay, so not too far away.
No, just a couple hours.
Take us back, if you would, to your initial surgery and the timeline thereafter.
I had had 5 children. My breasts were so stretched out and very deflated. So
Okay.
they recommended the lift.
All right.
I was so excited, went into surgery. I told him just go as big as you could. So 650 is what he told me he could go.
Okay. Did they look pretty good for a while?
They
Or were they
weren't-
uneven?
They were definitely off.
But they weren't off like they are now.
Oh, no, not at all. About 3 years after is when I started to notice my left one starting to get a little hard.
Encapsulated.
It's hard to say with my right one because I had some physical abuse going on too. My ex-husband was abusive, and I do know that there was at times where that particular side was, you know, hit or injured or, you know, stuff like that.
How long did that go on for?
25 years. The verbal abuse puts you into such a deep depression. Sometimes the words hurt more than the physical. It felt like I spent 25 years in a hell.
So you finally got past that relationship?
I did. I did. I got past it. It took a long time.
How long has this been going on?
3 years.
3 years.
Yes.
All right. So at some point, though, you gained more weight, but then you lost it all.
My highest weight was 284 pounds.
Whoa.
I had gastric sleeve.
Laparoscopically placed?
Yes.
Okay, good. How was that surgery?
Wonderful.
You knew her at this excessive weight.
Yes.
And you were obviously...
Didn't see that. Love, you don't see that.
That's so good.
You should see our wedding pictures. Like, he has this big, huge smile. And it makes me so happy because I can look at that and go, he loved me.
Oh, yeah.
Just the way I was.
Yeah. No matter how much you try and validate somebody, until they feel it in themselves, it's not going to matter. So you have to go along with them, and you have to support them the best you can.
That's right. Where's your head at in terms of what you'd like it to look like?
To be honest, I would like to look normal, to where I don't look like a freak.
Have you ever thought about getting it fixed before? Have you ever seen any plastic surgeons for that?
I have never seen any plastic surgeons for it. I have to have known that it was going to take somebody that was like a genius.
Are you inferring that he's a genius?
Absolutely.
Bastard. So why don't we go in the exam room and check it out? Because I want to see how much natural breast tissue you have. All right, let's go.
do it.
Awesome.
Hello. So first question is, are you under the muscle or not? Stand up and let's see you flex a little bit. I'm hoping you're under the muscle, and we'll know if these displace when you flex. Good, you are under the muscle, and the muscle's quite strong. On the left, you have a pretty significant capsular contracture. So it's tight with scar tissue, so the pocket is a little kind of almost too small. This side, however, has kind of the exact opposite problem. This one has absolutely no scar tissue at all. In fact, it's lost some of its structural integrity, preventing it from dropping down into your tummy. The right breast pocket needs to be tightened. The left pocket needs to be loosened. This is like a surgical multiple choice test. where the answer is D, all of the above. So here's the question. Is it fixable? So you don't have very much breast tissue. You could estimate that you have about 1 centimeter of breast tissue. What we like to have is at least 3 to 4 centimeters of breast tissue to make it safe. So it's a higher risk case because of that. Because if I do it just the way I would skin that wasn't stretched out, it will be loose in 6 weeks.
Right.
And it won't look very good. So you understand why the risks are quite high.
Absolutely.
Yeah.
Nothing is risk-free.
Right.
Sure.
Especially revisional surgery that we did.
Do I think you can have surgery in a potentially safe way? Yes. Is your risk of a postoperative complication elevated? No question about it. But do you want to go forward and try to make these look symmetrical and fix the asymmetry and the complications?
If there was anybody in the world I know that can do it, it'd be you, and I'd be honored. I feel like Dr. Dubrow and Dr. Nassif gave me all the information that I needed. I feel so excited that this part of my life, this chapter, is going to come to an end.
All right. Great pleasure meeting you.
Thank you for your time. This place is so beautiful.
I'm ready for a miracle.
I am feeling so nervous, but I'm most looking forward to being able to connect with my husband on a completely different level. Just being able to be open with him and not feeling insecure, and that excites me.
And away we get.
This is a very high-risk case. This is one of those cases where the best laid surgical plans could result in very significant postoperative complications, but we have no other choice. I'm really hopeful that I can do something really good for her. Let's do this thing. For Rebecca's surgery, I'll begin by opening the right breast pocket and remove the implant. I'll perform a capsulectomy and then build a wall to close off her pocket so the new implant will no longer fall into her armpit. On the left, I'll make an incision along her inframammary crease, remove her implant, I'll insert a new implant and perform a breast lift to remove the extreme skin laxity. Hopefully, Rebecca will have 2 matching breasts. This just goes to show you how much malposition she has. So the pocket is so far over here that it really needs to be here. So we have to build a wall right here. The original surgeon who did her surgery really got lost. The pocket, rather than being in the central part of the breast right behind the areola, is all the way over into her right lateral chest. I need to find something to make a wall, to keep it in the center and prevent it from falling over. Look how much soft tissue she has. None. She literally has nothing.
Case keeps getting better.
Yeah,
Better
no.
and better for you, Doc.
It's a very high risk case. So we have to close off this pocket right there. What to use? Let's take this side of this muscle fascia, nice and thick. This is a unique and weird idea. Just along the bottom of the rib cage, right exactly where she needs a wall, sits her pectoralis minor muscle, a muscle we basically ignore in breast revisional surgery. However, maybe I can incise it, rotate it up, and make a wall out of it. Well, let's see if it works. We're not touching this, baby. I'm not chasing this because I have to chase that all the way into the back. So we're gonna see how much that contracts now that the pressure's off it. Rebecca has a lot of residual loose skin under her right arm, but if I remove it, it'll leave a significantly ugly scar. And considering her laxity in the genital area, I think it might just tighten up by itself in the postoperative period. Let's take off all this loose skin. What a hard case, man. It's that stretching of the skin that makes this so crazy tricky and the lack of breast tissue. It's funny, I take out skin, I pull it together.
Loose again.
Loose again, immediately. Unlimited laxity. The left breast has such extensive soft tissue laxity that it has no shape. So I have to find a way to lift it without reducing the blood supply to the nipple too much. An alive nipple is a good nipple, making it a high risk for tissue loss and areola death. Okay, now we're getting somewhere.
That looks really good.
I think we've got sisters. They may be fraternal twins, but they have the same mother and father. Yeah, 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 yeah.
How you doing?
Hello.
Hey, guys.
Hello, you guys.
How do you feel?
I'm tired.
Okay.
A little sore, of course, but
Little sore. So, very challenging case. All right, so let's take a look. So, let's go.
Drum roll.
I'm watching his face.
I'm already happier looking at this.
He just smiled. And then look at his face. And then look at
Wow.
yours.
That skin looks pretty damn good.
Okay, so the truth. The nipple is totally alive. Yay. Look at this. This already looks tighter.
That's going to contract.
Right?
Yes.
Right?
I am just thankful. Because this is literally like a dream come true. Like I dreamt about this many, many times. You have no idea how much I appreciate it.
Wonderful job.
Oh my gosh.
Huh?
I can't believe this. Oh, they're wonderful.
It's so good, isn't it?
So good.
Take it easy with the arms. We'll keep a close eye on things if things change.
Thank you very much.
It's good.
God bless.
Thank you.
Baby, don't you cry no more. Just let the memories fade.
I can't remember a time that I wasn't insecure about my body. I started very young in, a relationship that was toxic, and there was always something wrong with me. Looking at my breasts all the time was just miserable for me. I never thought that those feelings would go away. And now that my breasts are not misshapen and they are actually, in my opinion, perfect, I feel so much better about myself.
Here, buddy, here. Want to go get it? Go get it. Go get it, buddy.
He's so crazy.
Yeah, he'll get it. He'll come back eventually.
Before my surgery, my breasts looked like a freak show. I thought I was doomed with it, forever that was gonna be me. And so now it feels amazing to be able to live life without that burden. I feel younger, I feel more confident. I'm in awe every day. And I'm still every single day jump out of the shower, stand in front of the mirror, and just, wow, my breasts look amazing. I feel completely different. It was that one thing that just made me,
Your confidence is shining through now.
Man, every day I look in the mirror and I haven't got used to him yet.
The work is just, he's good. Literally, Rebecca's like a new person. Now she has confidence. Now she's just glowing. Her inside, I didn't know that she needed to heal that much. But now looking back, she's come a long ways. This is life-changing.
I feel like I'm 25 again. I'm literally 49 years old.
I'm glad how everything turned out, babe.
I feel complete, that's for sure. I do not feel that Dr. Dubrow is a genius anymore. He's beyond genius. He's a miracle worker. I feel like I owe him my life. He gave me back things I've never felt before. Thank you for your support and all that. I couldn't have done it without you.
You're worth everything. I'd do anything for you.
I know.
I love you.
I love you too.
Any low-cut shirts, all you see is the areola. It's like, wait, what's going on? That's a scar.
I've only had one surgery, breast enhancement, and also a lift. After my children in my 30s, I noticed that my breasts were getting droopier and I started feeling insecure. That's when I decided to get surgery in Mexico. And I said, hey, it's cheaper, why not?
The baby is asleep, thank God.
She was a handful today.
Yeah, she was.
I did not get Devin to agree to this. I pretty much said, I'm gonna get it done. I actually took out a lump sum of my 401k, and I was able to schedule the consultation with that money that he doesn't know I touched.
He still doesn't know, right?
No.
When I got this surgery, I know things have changed. I want to have my self-confidence that I did prior.
Yeah.
I just don't feel like myself.
I feel like somebody did an experiment on me. The scarring looks like I have salami that has been sewed on. I just want the scarring to go away. I feel ashamed, and I am just carrying this guilt on me.
You're still sexy. You're still beautiful to me. It's okay. I'm here and we'll get through it.
So what do you have for me?
So, the picture says the whole thing. Her name is Adraly.
What is that? Is that areola or is it scar? That looks like you have a gigantic fungal mushroom cap on her breast.
We've seen port healing before. I've never seen this.
Can you please send in Adraly?
Adraly.
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 Nice to meet you,
Hi,
Dr.
Terry Dubrow.
Nassif.
Pleasure to meet you.
Nice to meet you.
Hey, Devin.
Dr.
Terry
Nassif.
Dubrow. Nice to meet you.
Terry Dubrow, Dr. Dubrow, whatever the hell you want to call him, just call him.
So, where do you live?
We live in Arizona. We love it.
Except for that damn weather.
You literally come out and your face melts. Okay, I'm going back
It's like
inside.
walking into the devil's ass. Excuse me for saying that. but
Devil's ass?
Yeah.
Yeah, but it is.
hot.
You guys have scorpions, don't you?
We do. We have spiders, and I am the biggest chicken when it comes to spiders.
Arachnophobia.
Big time.
I have to be the one that comes out.
I hate spiders.
Yes, I will admit it. I will scream.
You know what you need? You need a cat. I think the solution to almost anything is to get a cat. I love cats. You got spiders? Get a cat. Need a best friend? Get a cat. Have rats? Get a cat. Want to pick up chicks? Get a cat. Want to pick up dudes? Get a cat. Just do me a favor. Get a cat. I must say, I can't, for the life of me, figure out what could have caused this result. So please tell us all about it.
You know, I was thinking about surgeries throughout every child that I've had, and I'm like, oh, and I'll just wait. We'll just wait.
The mommy makeover kind of thing.
Correct. We're originally from San Diego. You know, 20 minutes down, you go into Tijuana, right?
Mhm.
Mexico.
Yep.
I have family there.
So was it a Zoom call? Was it teleconference?
Yes. I was actually in the closet, and he was like, what are you doing in there? Because I was hiding.
You did this in the closet because you knew Devin might hear you and he wouldn't approve.
Right. And he opens the door because he heard me talking.
Oh, he busted you. How often do you have a patient who has plastic surgery and doesn't tell their partner?
Pretty rare. I mean,
not a good idea. What if you end up having a complication or it's extremely expensive and you empty the bank accounts? I mean, pay the mortgage or have plastic surgery?
After you had your consult and when you were down there, did you do a formal, what we call a pre-op, where he showed you where the incisions were going to be, talked about risks?
That was the plan. It never happened. I fly down there the day before the surgery. I call the doctor and I said, hey, I just flew in. Are we able to meet? He said, you know what? Just come in tomorrow morning. That way we can just go through all that. So my mom and I, we get there early. He's still not in the office. He finally got in. He said, actually, we are running late. And I said, so we're gonna follow you? Because I don't even know what the surgery center is. He's like, you know what? I'm just gonna drive with you guys. He literally hopped in the back of the car.
Your surgeon hitched a ride in your car to the operating room.
That's correct.
So then you go into the operating room.
And they're like, so we're only gonna use a block?
A spinal block?
Yeah, almost like when you're giving birth,
An
right?
epidural.
And I'm already thinking, is this like cost efficient for them?
It
Because
is.
they don't have to spend
Much
more.
cheaper.
I'm saying like, no. But my body's like, no, like I'm asleep.
Yeah.
Wow, what a nightmare. Epidural anesthesia basically paralyzes all of the muscles below the area of anesthesia. And in this case, if you paralyze the main breathing muscle, the diaphragm, the patient can't breathe. So it's a particularly dangerous way to administer anesthesia.
So I wake up, they undo my bandages, I look up and I'm like, what the heck happened? All I see are two little balls. They were swollen, so they were like up, and I'm like, well, at least they're up.
But it didn't look like this initially.
Right.
Okay, so how did this happen?
So I fly back home a week and a half-ish. They're red all around. The whole breast is
You got
red.
infected.
The sutures that they used were non-dissolvable.
Did they pop open?
Yes. It became bigger and bigger to the point where it became half of my areola.
Right.
I booked the first flight that I found.
Okay, flew to Tijuana.
Yes. And he's like, nothing. He's like, hey, how's it going? And I'm over here like, are you effing kidding me? He's
Did
like,
you take out the stitches?
he didn't get them all out.
This is starting to make sense now.
And I'm like, you know what? I get back home, and as weeks progressed, I have little sutures pop out. So I just pulled it out.
And now the way her areola and nipple has formed together, I call them like nippiolas. It's literally a stretched nipple
Okay,
right out of it.
we want to help you. But let me ask you a question. What are your goals? Because you can't just poof and make this go away.
I actually want the scarring out.
So remove as much of the scar as possible.
Yeah.
Okay. Are you okay with the size?
No.
You want it bigger?
Yes.
So you want the scarring removed, you want them bigger.
Wow.
Well, you have to imagine, to remove scar tissue, you have to take the surrounding breast skin out. So as you do that, things are getting tighter.
Okay.
Theoretically, it's possible if we remove all that scar tissue that you have to downsize the implant. It's like stuffing the suitcase. If you add more clothes to it, it's gonna pop. Here's the thing. I just don't get how you can get this much scarring from one operation.
How you can reduce the scar if you want to go bigger? That's not going to happen.
What happened? I just don't get it. Hey,
guys.
How are you guys?
Good.
Good. Okay, so we've been doing this for 3 decades, tens of thousands of cases. We have seen every complication known to man. Never seen this. You have unusual scarring around the areola, which is sort of taken over. If you made an incision around the areola here, and then you made an incision here, and you close it, it's gonna lift the nipple way up there.
Oh, yeah.
Can you even cut out all the excess scar and get covering of this implant without it being under too much tension? So, to a certain degree, what size breast implant you want dictates how much scar you can remove.
Let me ask my husband this time, since I didn't ask him last time.
The bigger might not be the best option. It's to whatever they can do to get the most scarring to look the best.
Bingo.
Right.
Clearly, the main potential complication that we're worried about, besides all the usual ones, is scar widening. Adraly's case is really difficult because she has a lot of scar which occupies a lot of the actual breast mound. My main goal is to remove the scar, but I don't know how much I can remove until I'm actually in surgery and see how much surrounding laxity there is.
But like one side of me, like I do want big
Fullness.
breasts, like fullness, because I've never had cleavage. But it is important to remove all that scarring because that's what affects me the most is looking at the scar.
And it sounds like, though, from what I've heard, you're on board.
I am, 100%. Are you on board this
Yes.
time? Sorry.
Yes, no,
Sorry.
I am.
All right. Before we go, I want to ask you one question. I have to go somewhere. Could you guys give me a ride?
Yeah, you know the back.
And with that, we're going to go.
Thank you.
That's funny. We can fit you too if you want. Wow, I can't believe today is surgery day.
I cannot believe it either. How you feeling?
I'm more excited on what's to come, you know.
Me too.
Devin hasn't seen much of my breast in the past 2 years. Our, sex life has decreased. We've detached ourselves, so it's put a strain on our relationship. So we're hopeful that it kind of rekindles our intimacy.
Hi, Adraly. How are you?
Very excited.
Hi, nice to see you.
I'm excited too. Sit up for a second. I want to show you something. It occurred to me last night when I was studying your case. After you remove the scar, what % of your breast skin is left? So how can we figure that out? Well, do you remember the area of a circle from high school? Pi r squared, okay? So the equation is radius squared times pi is the area of your entire breast. All right, it's 22 centimeters. So at 3.14 And R equals the diameter. So 11 squared,
3.1.
379, 136 squares entire breast. What is scar? 34%. So the question is, can I remove 1/3 of your entire breast skin and still be able to put a reasonable implant in? That's the question. For Adraly's surgery, I'm going to first remove her previous implants and assess her pocket for skin laxity. I will then insert new implants, make an incision around her areolas and around the outer scarring, and then remove as much scar tissue as I can. Finally, I will give her a breast lift and hopefully give her the full scar-free breast she deserves. First thing is, let's get the implants out. She thinks it's a 330. It is 330. Good. Look at this line in here from being squeezed so intensely, it's left a permanent mark in there. All right, let's try a 330. The question is, can we get Adraly's scarring removed and get good breast shape? To do this, according to the mathematics, we have to remove 1/3 of her breast tissue. Look, math be damned, let's see whether it's even possible. For every millimeter of skin you remove, blood supply is compromised, so the skin that remains may die, and it may be under too much tension. Okay, let's staple the scar to test how much laxity we have before we commit to cutting it off. All right, say we remove this to that, this to that. Oh gosh, we're getting a lot more laxity than I expected. We could definitely do at least the same size and maybe a little bit bigger on this side, but we better test this side out before we make a commitment because scarring is much higher. Unfortunately, Adraly has a very uneven amount of scarring on each breast. So in order to obtain symmetry, I have to asymmetrically remove the scar. Look, it's still lax. We might be able to do 350. Am I pushing the envelope? Literally?
Literally.
Okay, let's take the staples out and put an implant in. Just a really interesting and difficult geometry problem superimposed with a really difficult surgical problem. But it's, let's be honest, super cool. Here's to you, Devin. 20 cc's extra. Okay. Yeah, it fits well. Time to remove some skin. Jeez, never taken that much skin off on such a small breast. So all the scars removed off the right breast. It's gonna be really hard to match the shapes. It's good. Let's play with the other side, see what we can do. All right, here we go. Big question is, will I be able to now staple this closed? And will the nipple stay alive? That's a whole nother issue. I still have to make sure that the scar that I removed left enough blood supply so that the nipple and the areola can heal and that the overall wound isn't under too much tension. Okay, they're cousins, they're pretty close cousins, you know, they might not be identical twins. I was able to get all the scar off. They're pretty symmetrical. I got the size implant she wants. Now all we have to do is heal. This is one of the most difficult math tests I've ever taken.
Hello. Hey, what's up? How are you? How are you?
Good to see you too.
Nice to see you.
Okay, you wanted to be slightly larger.
Mm-hmm.
So you had 330s, but put a 350 in there.
Nice.
And then this was the skin. So I was able to remove all of
No way.
the scar on both sides.
I'm like in shock. You were able to remove all of it.
How the hell did you do that?
How the hell did you do that?
I am beyond ecstatic. Everybody knows he's the best of the best. So I already knew he was badass doctor. But once we got to surgery, he came up with the formula of my boobs.
Right.
After the surgery, I graded him at A+, 150%.
So we're looking to see if so is that nipple alive? I know you're not a plastic surgeon, but.
Yeah.
Oh my God, I looked down, I don't see scars. I'm like in shock.
Yeah, man. Dr. Dubrow wanted to just take the scarring out, but at the same time, hopefully achieve a bigger breast. And he did both. I'm I'm mind blown. I'm super stoked.
You know, that infiltrative scarring process that you have, I don't know why that happened. And so could it happen again? Well, it could. We're going to keep a very close eye on this.
Okay.
Congratulations. Got all the scar out. Went bigger.
You got him back.
My pleasure.
My man.
Looking back after everything that I went through and having that surgery that left me with those ugly scars, I now wake up every day and feel like I have a second chance of life. I've learned to appreciate who I am, love myself for who I am.
Damn, girl, you look good.
Got a lot of stuff in there.
Yeah. I'm excited to just get in the sun, relax, soak some stuff up.
We have no kids.
No
We
kids.
did it at the same time.
No kids.
Before my surgery, a trip to Tijuana left me with 2 ugly-looking salami nipples. It affected my life every day, and it also affected my intimacy with my husband. Now, thanks to Dr. Dubrow, I have no more scarring. The nipples look fabulous. I have to look at myself a few times before saying, wait, did he really do this? Is this? I don't know how he did it. I just want to like wear nothing throughout the whole house. Is that a gift?
No peeking. This is that's for later, okay? You'll look very, very sexy.
Oh, a little something, something for later. Yes. Devin actually knows I came clean. I told him I took the money from the 401k. I did something bad, and I promised that I was gonna put the money back. I need to have some tan in these dudes because they haven't seen the sunlight in a few years.
Right.
So what if I just like flash everybody now because I'm super happy?
Yeah, the truckers.
I'll stop.
Okay.
Honk.
Our next patient's named Christina, who has a complication from breast augmentation surgery. Very different in each breast, but you got to see the picture because that says everything. Check this out. Isn't that interesting?
How did that happen?
I think this skin was disproportionately stretched.
I mean, the nipple's going over there.
You really can't move the nipple side to side very well. You can move it up and down, but you really can't move it side to side. Super weird, right? Super interesting. Let's be honest, super difficult.
My breasts look like a hot mess. I've only had 1 breast surgery, and instead of making me feel like a showstopper, they made me into a sideshow attraction. They're like a carnival act. Like to look at them, you'd be like, are you serious? Somebody did that to you? When I was 21 years old, I started to develop issues like metabolic syndrome and some other things that were causing my weight to escalate quickly, blood pressure to go really high. So at 36 years old, I had gastric sleeve surgery. It was successful like right away, and my weight loss turned into a fitness journey. For a good 4 years, I was in the gym like twice a day. I became so obsessed with working out because I wanted that perfect body that I never had. However, I traded being this big, overweight girl to being thinner, but now having breasts that were just hanging off of me. And I knew that I wanted to get my boobs done. I worked really hard on my fitness. I worked really hard on my weight loss. I just wanted those breasts just to like be like the cherry on my sundae of everything that I've worked so hard to accomplish. But I had my breast surgery and it was not successful. They looked terrible. So I'm in pain pretty much even right now as I'm sitting here because I'm off center, I'm lopsided. So a lot of the heaviness goes this way, my back hurts, my shoulder. My breast surgery has affected all aspects of my life, my personal life, my love life, and it has completely stopped my fitness journey. I don't feel like I'm that Chrissy that I want to be.
Hi, coming in. Dr. Nassif.
How are you, Terry? Real pleasure to meet you. So I must say, we were looking at your photos.
Yes.
And you know, we do complications for a living, but you have something quite unusual. You have complications each one of your breasts, right? But the left areola is way over.
Yeah.
Tell us about that.
I got pregnant and I developed some issues when I was pregnant that created like hormonal issues. So I gained a lot of weight. I went to see my primary. He was like, I know you've been trying to lose weight. I want to submit you for weight loss surgery.
How much weight did you lose total?
172 pounds in the past 10 years.
172?
Yeah. My breast left me.
Yes.
And so I wanted this surgery for a long time. So I go in, I do my consults. I want my body, I want to start doing all the things I want to do. So I'm like, yes, give me the biggest ones you have, let's put them in.
I think you got a 700
40?
745 cc.
745.
That's pretty damn
that's
big.
pretty big because it only goes maybe a shot glass larger than that. How'd it go?
Terrible.
Right away?
Terrible. Yeah.
Why?
I looked and I was like, why is my nipple pointing that way?
It was?
Oh yeah.
Immediately?
Oh yeah. Oh yeah. I went in to see the doctor several times and they just kept saying to me that was just your body healing and this is a part of the process.
So were you friends when she was having these surgical procedures? Did you know about them?
She FaceTimed me a lot and then she's like, is this normal? And I was like, that is absolutely not normal.
I've never seen a patient like Chrissy whose nipple was so far displaced immediately after surgery. I'm not sure exactly how this could have happened, whether the doctor was just having a really bad day or he was under the influence of something that I'd rather not know about, but I've got to find a way to fix this.
So then this one, I felt it just fall.
So it was perfectly there with the nipple in the center and then the whole mound dropped.
Yes.
And of course the nipple went up, right?
Yes. And I'm like, this is so weird. It's like something snapped.
Chrissy has a very significant bottoming out phenomenon. This results from either using a very heavy implant in a patient with very thin skin, or if it occurs immediately after surgery, unfortunately, it's a result of very overzealous dissection and improperly done surgery.
I know it sounds like, oh, it's just a boob job, but having this surgery is like, I wanted it so badly so I'd feel good about myself because I worked so hard.
And now how do you feel? Oh, I'm sorry.
It's okay. Sorry.
Yeah, no, I can imagine.
It was just hard.
Okay, I want to make a few little measurements to see how far displaced the nipple really is, because the further over it is, the more challenging it could be to get it where we want it. So let's take a look. Oh yeah, it really is very far over there, isn't it? Okay, when you look to see how far from the center the left nipple is, it's about 5 centimeters from the center. And if you move this over that way, it gets it close. I mean, I think this one is bottomed out. So this one needs a capsulectomy, which is removal of scar tissue, a new implant, smaller. On the right, you would take the implant out, tighten up the breast implant pocket, and tighten up the envelope. Chrissy has a very difficult problem. One breast is very low, the other breast is very high, and the nipple points into the armpit. This is an extraordinarily difficult problem, and it may not even be possible to give Chrissy the symmetry she wants. What do you think about this?
I'm concerned,
Good.
but I've already told her prior to this, like, I'm here for you, I'll help take care of you, but it still makes me nervous.
I mean, you know, there is a greater chance of reduction of blood supply to the nipple.
Yeah.
In fact, you could lose both nipples.
Right.
It's on the table. So, do you want to undergo these high-risk procedures? Because these are not easy.
God brought me here to you, Dr. Dubrow, so I think that
God may have brought you to me, but you are now currently sitting in front of a surgical God, so just know that.
as we know.
Let's go.
As we know.
Pleasure, pleasure. Let me get him out of here after saying this stupid.
I've thought about this for days now, about how it's gonna feel to have normal, beautiful boobs. For the past few years, I've had these awful breasts and they've been painful, and it's been like the most horrific journey to where I'm at now, where I have a doctor who is about to give me everything I wanted, and I get to just go back out into the world and just feel like myself.
For Chrissy's surgery today, I will begin by making an incision along her inframammary crease and remove her old implants. On the right, I will perform a capsulorrhaphy to raise and tighten the pocket. Then I will insert a new implant and perform a mastopexy to reduce the size of her skin envelope. On the left, I'll do a capsulectomy to release the muscle and lower the pocket. Insert a new implant and perform a breast lift, which will hopefully move the nipple more towards the center of the breast mound. So first thing we're gonna do is open up this right one and assess the pocket, see what the implant looks like. There it is, there's the implant. Look at this.
Wow.
Talk about deflation. Okay, now, before I put an implant in here, I want to take this implant out. I want to see what that pocket's like. All right, so here's the implant. All right, let's check this out. So we're gonna do a capsulorrhaphy on the right, which is a procedure where we tighten the pocket so it doesn't fall into the armpit. And it fixes the bottoming out all at the same time.
One of Chrissy's fundamental problems is that her pocket is in the wrong place. It's too low. In order to build her a new pocket in the right place, you have to use strong tissue. So what I'm gonna do is use her pectoralis muscle and the scarring around it. And this is a procedure I've done many times, but that doesn't make it any easier each time you do it.
Now we have to shape the tissue envelope. I don't think I've ever removed this much skin from the bottom of a breast. Come on, is that nice or what? Now let's go to the weird side. This is gonna be the most challenging part because that pocket's super high, that pocket was low. There it is, there's the muscle. Okay, let's put the implant in. 700 cc. So I lowered this pocket a little bit, raised the other pocket a little bit. Hopefully we're meeting in the middle. Oh my God, they look so good with that nipple. What am I gonna do about that nipple? Like, it makes you wonder if I could go like that. I wonder if I could sheet it like that. This will be totally made up if this works.
It's very easy to move a nipple up and down. But to move it side to side, you have to remove skin from one side to get it to displace over to that side.
Wow. Super weird, super cool. We're doing it.
That typically doesn't work very well because it looks very distorted and gives it this kind of appearance. But it seems to be working in this setting.
I think this is very successful. Let's close.
OMG, that went well. That was good. That was satisfying.
I actually was able to find a way to move the left nipple and areola over to where it's almost symmetrical with the right side.
You're really not supposed to be able to do that, but sometimes you just gotta go for it, you know?
Hello. Good to see you.
Hi, good to see you.
How you feeling?
I feel great. I feel good.
Okay.
I feel really good.
So let's take a look.
No drains, huh?
No. All right, let's just take
it. Okay.
Well, they don't look small.
No, they're not. Yeah, it's pretty rock star. Pretty rock star. So, yeah, so this is really good.
Well, you did it.
So this one is 10.5 centimeters from the middle, and this one is, it's 11. So it's half a centimeter off, so it's 5 millimeters difference.
That's nothing.
So that's within nature's normal.
Yeah, you got about a good 90% correction of that.
Yes, and then 100% of everything else.
I love it.
Yeah.
I
Cool,
do.
right?
I love it. This is so awesome. They're beautiful and perfect and soft and light, and my nipples pointed the right direction. They just look so beautiful. Like, that's literally how I feel. There's just a pretty, beautiful breast that I really, really wanted.
There was no way I thought that nipple was moving.
Yeah.
Yeah, beautiful result. Congratulations.
I love you. Thank you so much, Dr. Dubrow.
This is good.
Like, oh my God, this is so awesome. This is how it's supposed to feel after a surgery like this. I'm so happy.
Congratulations.
You guys are the best.
You're welcome.
I
Yeah,
cannot
it's
tell
good.
you.
Come on, you wonder worker.
I am.
That's good. All right, we'll see you
Thank
soon.
you so much.
This is how you do it now.
Looking back at the past few years of my life, after one failed surgery, my breasts were destroyed.
This is how you get it done.
I felt mutilated. I felt discouraged.
It's been a long road of not having breasts, then having the wrong breast, and then the pain.
I've always dreamed of being the total package, and now I am.
This is my house. Step on up and get some.
I wasn't ready.
Before the surgery, I've been living for almost 3 years with a breast that was almost in my shoulder and another one that was almost on my waist. And worst of all, my left nipple was on the run and completely facing the wrong direction. Now, thanks to Dr. Dubrow, my breasts are symmetric. They are round, soft, pretty. My nipples face the same way. I touch them every day.
When you have something that's been so horrible and so painful and horrific, and then you have this
amazing doctor who just like totally took care of me, like from start to finish, and like made me like normal. And I'm so thankful for him. And I know it sounds stupid maybe to some people. To me, it was life-changing, and I will never, ever forget that he did this for me. Like, amazing. This, perfect. Like, perfect. Amazing. Amazing. And I feel great. And I'm so happy to get on this bull and ride it. You ride that bull, girl.
Get it.
We have a very interesting patient named Chase, who's a trans male, and the top surgery was done very, very poorly. Look at the chest surgery. I know. What was the plan for this
haphazard plan?
My chest is concaved in quite a bit. I have excess skin. One of my nipples looks like a piece of salami, and the other one looks like Halley's Comet. It's like the little ball with the rest of that. This is feeling really good on my toes.
You don't want to get in one?
I'm acclimating.
Why are you so nervous?
I'm not nervous.
You're my freaking cousin. Like,
I'm not nervous, it's, you know. When I was younger, it didn't feel comfortable the way I was living as a female. I could tell it was a little bit different. I was called a tomboy, which I was okay with, because I was like, okay, well, as long as I get to play with the army guys in my backyard, I'm cool. A lot of times we would play the Smurfs, and they always insisted that I was Smurfette. I, however, wanted to be Hefty Smurf. There was a little battle there, but Hefty Smurf won. Around 13, my body started to change in directions that I was not, I guess, prepared for. I was looking in the mirror saying, well, wait a minute, this is not right. In high school, thought maybe I'm a lesbian. You know, I see these butch women out there. Maybe that's the direction I'm supposed to be in, and maybe that's where I'm supposed to go.
don't splash me.
Around 30, this is when the movie Boys Don't Cry came out. So it was like, oh, that's an option? I can transition from female to male? That's like a thing? So the next step was to take hormones, take testosterone. I was like, okay, this is happening, but this is still here, and wait a minute. I had to change and have the top surgery. I did everything I was supposed to do so that I can take off my shirt comfortably.
But
and I can't, no. It's like a mental block. I need to fix this. This has to get fixed before I can fully say, look at me. You know, I'm trans, I'm you know, male, look at my chest, look at my hair on my chest, you know? I mean, it's like, I want to be confident in who I am. Can you see the salami? So when they did my surgery, I felt like he went in with like an ice cream scooper, scooped, threw, and then threw on the salami. I don't know why I have so many food metaphors.
Salami.
Hello.
Hey,
how you doing?
How are you guys?
Dr. Nassif.
Gloria.
Terry Dubrow, pleasure to meet you.
Nice to
How are
meet
you?
you.
Nice to meet you too.
Nice to meet you both. So, how do you know each other?
We're cousins.
Oh, cousins.
We're the black sheeps of the family.
You two
if
are?
haven't noticed. Yeah.
Okay. Yeah, so I must say, you have an interesting anatomical situation. Take us back to your surgery journey.
Okay, yeah, sure. So when I was younger, I was kind of getting heavier, and I think a lot of it had to do with like not really sure about my gender identity and how I felt about myself.
Right.
You know, looking back, I think it's just by eating a lot and gaining weight. The more weight I had, the more I was able to push people away.
You basically created your own barrier around yourself, your own wall of like fat, basically, to keep everybody away.
Right. Okay, so how much weight did you end up gaining?
My maximum weight was, I believe, between 450 and 425. So I got approved to have a gastric bypass.
And how much weight did you lose?
Over 250.
Wow.
Yep.
All right, so after the weight loss is when you decided, I'm gonna start transitioning, right?
Right.
And what was the first thing you decided to do in terms of all that excess skin? The chest or the abdomen?
The abdomen.
So that was fixed, but cosmetically you weren't that pleased.
No. I mean, it wasn't bad here, it's just he left everything on the sides of it.
Let's talk about the chest. So you decided to have top surgery, correct?
Right.
What sort of cup
I was like
size
a D. So I decided to go back to the surgeon who had done my stomach. In essence, I was his guinea pig because I was the first one he ever did it with.
The first top surgery he was ever did?
I was his first top surgery.
Wow, he picked the hardest kind.
Well, I gave him photos and I showed him different procedures of how they are normally done.
You felt like you had to educate your surgeon. Oh, boy.
You know, looked at it and he said, yeah, I could probably try it.
I could probably try it. Try food, try a new restaurant, try a movie. If your surgeon says to you, I can probably try it.
Run.
Run. There's no trying. You either can or you can't.
What happened following that surgery then?
The areolas were really big, a lot of puckering around the...
Right away.
Yeah, and actually one of them split on the side. So like now there's like a line from here to here.
Yeah, we saw it.
It's a big dark scar going off to the side laterally.
Yeah.
So very disappointing.
Yeah. The way I can explain it is like there's some sort of like rite of passage, I feel like, when you have top surgery for trans men.
Yeah.
And it's like this ability to go to the beach and be able to take off your shirt. And I never had that rite of passage. I never had that chance to like show the world like, hey, look at me now. Almost as though I never had it, you know, and it feels like I'm back to binding and just being in that closet.
That would be nice to give that to you.
Yeah.
What would be your goal?
Smaller areolas. Like
Smaller areola.
the placement of the nipples, the way he had them, it's like almost...
There's social distancing on the worst way.
Yeah, it's like...
The social...
In this direction?
Yeah.
And then what about the rest, that excess skin?
I would like to have this a little more taunt in some way that matches the front, you know?
A good-looking torso, upper torso,
Yeah.
what is it?
Although good looking is in the eye of the beholder. For example, he thinks he's really good looking. And so let's be honest, you know. I mean, I want this guy's mirror, okay? Although, does he even recognize himself anymore after all that plastic surgery? But anyway, I digress.
This is kind of what I had before. It was flat. It was like...
Dang, that much?
Hello. Hello, you're Zoom. Okay. So, let's see. I know, Chase, one of your main issues is you have loose skin, dilated areolas, you have malpositioned areolas.
Yeah.
There's social distancing, as you said.
Yeah.
And then you've got laxity way into the side of the chest here.
How come it's so indented in here like that? Like on this side, it feels like almost muscle is not even.
Well, they took a lot of breast tissue, and in certain places they took too much breast tissue. My advice for surgeons who might predispose to taking too much tissue is, when you're new in this game, less is more, because it's a lot easier to make the problem than it is to fix it. The most common way you would do a procedure like this is you make an incision around the areola, and then you hockey stick it. You come across like this all the way into here. Now, do me a favor, stand up for a second, let me see the tummy. So, even though you had a ton of skin removed, you still have a lot of excess. The doctor probably should have made that incision and tightened in this direction. So it just needs to be redone. All right, cover up for a sec.
Okay.
Yes, thank you.
Yeah. This is a tricky case. Your chance of a complication is greatly elevated. So
What would the complication be?
Oh, the nipples could die, the wounds could pop open, we could get infection, all sorts of things can happen. We have some work to do.
I want to get this done.
You sure? You're 100% in.
You're gonna complete the journey with me.
Don't you want to be on that journey with them?
I do. I really want to.
I've hit a lot of hurdles in life and just like a lot of bumps and climbed so many mountains to get to where I want to be. I'm almost there. Dr. Dubrow, please help me cross this finish line. I'm just ready to take it off.
Take it off, baby. Chase.
Hi.
Good to see you. Met Heidi.
Hi, Heidi. How are you doing?
Good, how are you?
Good, thank you.
So we have to fix the bad plan that was executed on you.
Yeah. There's something about when you look in the mirror and you see what you've always seen in your head reflect back in the mirror to you, and I'm like there. I'm like, I could literally see the finish line. So let's go, let's do this. Let's rock.
All right, let's do this thing. You're welcome.
Thank you.
Today for Chase's surgery, I will start by reducing the size of the areolas. Then I will use the hockey stick approach to remove the excess tissue and tighten the skin from his chest all the way around under his armpits. Next, I will make a horizontal incision across his lower abdomen, followed by a vertical incision. I will then remove the skin laxity from both directions and then close, hopefully leaving Chase feeling more self-confident about his body. All right, let's reduce the areola first. That surgeon should have known better. I mean, I don't care if you've never done this before, you should know that this would never have worked. Let me just staple up some of this. I've already tightened up the medial pole already just by doing that. I've got some nice tightening around the areola and the inner portion. I'm optimistic, but there's still a lot of work left to do, and I have to deal with those underlying dents before I can have a really good outcome. It's a bit of a puzzle, this. I need this to come down here. The nipple's too high. Pull this way. Give me a lot of those chunks of tissue, that's for sure. All right, let's staple this up. Okay, so that's the first step in the chest. Let's see if we can take care of some of this. All right, give me a staple right there. All right, I think that's good for now. Tricky, but at least this gives me a better idea of what to do on the other side. Okay, good. Let's do the left side. Now the challenge is to try to match the left to the right. It's one thing to get one side to look good and get the other to look good as well, but they have to match, otherwise you don't have a good outcome. Okay, I think that's good. Exact same thing on the left side as the right. New pocket made. It's pretty good. I think I can live with this. This could work and the nipples seem alive. All right, let's go on to the second part, the abdomen. I mean, look, this is bleeding like crazy. This is good. This will heal. As of right now, I've got pretty good blood supply. I'm concerned though, if I remove any more skin, which I might need to do, that I can take it from good blood supply to impaired blood supply and compromise the entire operation. Look at that. That which is bleeding is that which is healing. Wow. This is a very significant improvement, and I'm very happy with this. All right, it's closing time, Chase. Last call. I'm hilarious. Chase.
How's it
How are
going?
you, buddy?
How are you doing?
Big smile, huh?
Oh, yeah. Oh, yeah.
How much pain are you in?
I'm not in very much pain. Like, the past surgeries were really painful. This one, I'm like walking around, I'm really not feeling any pain.
Good. Okay, good. Let me ask you a question. Why is it that most of my patients postoperatively are in no pain and yours are in tremendous pain? Is it your personality?
They love me post-surgically. Very attentive, very sweet, very loving.
Loving, sweet, you?
I am.
So, the question is the tissue having any early signs of blood vessel impairment, blood supply problems? I mean, you can see that's a pretty powerful difference on the sides, Little swelling here. Now you have a fine line scar. Remember how wide your scar was? Remember how big these bulges are? Yeah, this is great. All right, here's the chest. So, okay, let's see these. Okay, so I think this is actually really quite good, if I do say so. So as you can see, that hockey stick incision in here.
I'm over the moon. I'm so happy with the results. I love the size. They look normal.
They look normal.
I knew that Dr. Dubrow was going to be the one to be able to fix it, and he did. Everything that I imagined is now reality. So that's amazing and awesome in of itself. What you've done for me is beyond a thank you. It's like you're a part of my life forever because you helped me re-transform my life, and that's just, I can't thank you enough.
I appreciate you saying that. No matter where we go from here, we're gonna keep going forward.
You helped me finish my journey.
It doesn't matter where you come from, it only matters where you end up. The story's never the beginning. Oh, it's always how you finish.
It's been a long 15 years of just like wanting to like say, this is me. And I couldn't do that with my previous surgeries because they didn't work. But now I'm there and I'm excited and I can take off my shirt and I could be fine because for the first time in my life, I feel good in my skin. I see a sexy silver fox.
Look at you with your button down. I know.
I mean, I feel so good that I can like.
Yeah. Wait, where's my dollar bills? Huh?
Before my surgery with Dr. Dubrow, I was always self-conscious even to look at myself in the mirror. But after Dr. Dubrow did the magic touch, he was able to take away all the dog ears, the excess skin, and give me the proper size areola that should have been there all along. My nipples are no longer social distancing like my cousin Gloria would say.
You look a lot smaller too. I think it's because of you were wearing all those big clothes that it made you look bigger.
Right.
And you really weren't.
I think that's the biggest thing that Dr. Dubrow gave me. Now I can go start dating again and feel pretty confident about doing it, you know?
Oh yeah.
Yeah.
I worked with Chase on some dating profiles. I mean, I think he's gonna get a match right away. I don't doubt it. Look at him, he looks incredible. You become the best version of you, and to see that like continue to grow has been so special. Your smile is like so contagious right now. It makes me so happy to see you.
You're like
so happy.
glowing, dude.
I haven't felt this good, and I don't even know how long. Being able just to cross that finish line and knowing that I'm done, I'm finally done. I now feel and present and know I am the guy out there. You know, I'm the man. I'm the man.
You know what you deserve?
What?
You deserve some mimosas. That's right.
Let's do it. Let's
We're
do
gonna
it. You guys know where to go?
Down the street, yeah.
We're going that way.
Reach for your dreams, reach out, reach for your dreams.
My breasts have been described as many things: spaghetti squash, ciabatta rolls, or shaped like bricks. They're just bizarre. I have never seen boobs like this. I was 22 when I met my ex-husband, and we dated for 6 months and then we eloped. Things kind of got hard in our marriage. There was some infidelity. So after 25 years of marriage, we decided that we needed to part ways. It was one of the hardest decisions I've ever had to make in my life, and I felt the lowest I've ever felt. After nursing kids, I had decent-sized breasts, but they were very saggy. That kind of led me to decide, oh my goodness, I cannot go on in life unless I fix some things about how I look. Hi.
Hey.
Ready to?
You just come from work?
Yes, I
Give me a hug,
did.
give me a hug, give me a hug, give me a hug.
The 2 surgeries messed me up. I need to get waxed.
It's a good thing you have a good friend that's willing to, like, you know, get you in anytime on her appointments, squeeze you in between people.
You know, I appreciate you.
I know
I'm
you
very
do.
grateful
I know you do.
for doing that for me.
It's pretty tricky to wax your underarms.
Yeah. I know different women who have gotten implants. Not one woman has told me they can't shave their armpits after surgery. You know, I can't hold one hand, make it flat, and try to shave with this arm, but that's kind of what I tried to do. So I always have stubble. I have to be waxed all the time. I originally thought that he messed up something and that's why I couldn't shave, but now I kind of feel like the implant is right here and that's why I can't shave. I don't know, it's bizarre. I've spent over $30,000 to give myself confidence, to make myself look good, going back into the dating pool, and I can't even do that because I'm mortified with how I look. And trying to do this at 50 is hard and is scary. I'm still alone. I still haven't dated anybody. I don't want to think that I'm disfigured. I'm ready to move forward from this.
Look at that.
Oh,
how unacceptable is this? Look at this. Implant breast. Let's go meet Jennifer. Let's see if there's something we can do to fix this. All right,
let's go.
Let's go.
Hello.
Hello.
Hey, guys.
Hi there.
I'm Dr. Nassif.
Hi. Nice to meet you.
What's your name, though?
Rachel.
Hi, Rachel. Terry Dubrow. Pleasure
I'm Rachel.
to meet
Nice
you.
to meet you.
Jennifer?
Jennifer.
Where are you both from?
Sonora.
By Yosemite. About an
California.
hour by, yeah, we're in California.
Oh.
Yeah. Take us back and tell us your journey to get to this point.
After 26 years of marriage, I get a divorce, and I'm thinking, how am I gonna date?
Right.
Looking as I do, I feel frantic that I need to get some things fixed. Who's gonna want me? And so I found a doctor.
What did you have? What procedures?
So he did a lower body lift.
Wow.
He did some liposuction, a breast lift and implant at the same time.
Okay. What size implants?
350.
Were they high initially?
Yeah, but they looked okay. But I have this weird like scab thing. He goes, oh, everything is fine. The next day, that thing busted open, and I had a wound on me about this big that took like 4 months to heal. It was disgusting. It was rough.
Implants were left in.
Yes. I go see him for the year checkup, and I'm like, they don't look right, and they're tiny. This is not what I wanted. So he's like, well, this is what we can do. We can do another surgery, do another lift, put new implants in. He goes, do you want to go bigger? And I said, yes. And I would think within 2 to 3 weeks, breast tissue starting to fall, implants are staying here. My breasts are all perpendicular.
Well, it looks like someone took a 2x4 and just smashed them into her, you know? And it looks like they just went like a splattered egg.
I love her?
I know. Most of the friends, well, she's okay.
No.
She's downplaying it.
She's your beautiful butt.
We have 40 years of a friendship. She did end up going to get a second opinion.
Yeah,
and the lady said, maybe I can
if
fix
I
them.
can fix it, it was
because
like,
this is not simple.
No.
this doctor said, if I could fix it, it was gonna be another $20,000. I don't have another $20,000 to fix it. So I kind of like resigned myself to, I guess I'm stuck with this.
And I told her, I go, you have to get a hold of Terry Dubrow and his amazing friend, Nassif.
Okay. Okay, you just lost all credibility.
Exactly. What is a bummer is that the divorce made you feel horrible. You wanted to do something to make yourself feel better, and then you have a couple surgeries, and they all turn out this way.
Well, the plastic surgeries made you feel worse, in fact.
It did. I want to move on from this and not let it keep bothering me and hold me back. You know, I want to move forward, and I do want to find somebody, and I do want to date.
Yeah.
And not feel like this is something that keeps me stuck.
So in your case, I'm not sure what component of this is your body's reaction to the foreign body of the breast implants, and what component is responsible from the surgeon's technique point of view. Meaning, even if you have a perfectly executed surgical revision, will that result in a good outcome, or will this happen again?
Hello.
Hey. Okay, so do me a favor, Jeff. Stand up, and I want to see a couple of things. So, you're very firm, but I don't think I've ever seen capsular contracture send it up this high, because you're really only what we call a finger breadth and a half, in the width of 1.5 fingers from your clavicle. So you do have some laxity out here.
Yeah. And that
some laxity out here.
Makes them not look round, they look square.
Well,
ciabatta bread.
you heal scars well, though, don't you? Okay, so have a seat. Let me tell you what I think may be going on. If it's improperly done surgery, you can properly do the surgery theoretically to fix it. So I would probably do it through the areola, just to go into the pocket. Look inside the pocket to see whether it's scar tissue that's pushed things up, or inadequate muscle release, not allowing the implant to drop in, or a component of both. Okay. Right?
Yeah.
If the muscle release wasn't done adequately, it's very fixable, but if it's from scar tissue, even if I release the scar tissue, that can easily come back post-operatively. If you were to do this, what size would you want to be? Do you want to be a full D?
Yeah.
You want to have big breasts?
I do.
Do you think this is something you're interested in doing?
I do.
So you think she should do it?
Oh, yes, definitely. You need to do this.
She's tired of looking at my boobs,
I'm tired of making fun of you. I feel bad. I feel kind of guilty
By the
in a
way,
way.
I see similarities between this relationship and this one, to be honest with you.
Yes, definitely.
It's like
I'm just
Hey, what's cooking?
Good morning.
How are you?
I am fine. How are you?
Good. We met Heidi.
I have not met Heidi.
I'm This is Heidi.
Very
Heidi.
nice to meet you. Nice to meet you.
Do me a favor. Sit over the side.
Okay.
So Heidi, check this out.
Yeah.
At first glance, what does it look like she has? Ready?
Capsular contraction.
Capsular contraction.
Mhm.
So the plan is to go in and marry the breast
Yeah.
implants with your breast mound.
Mhm.
Because right now,
It's just a mess.
geographically, they're not even in the same
They're
zip
neighbors.
code. They're neighbors. Today for Jennifer's surgery, I'm going to make an incision along her inframammary crease and remove her old implants. Next, I will either release the muscle or remove scar tissue or both before stitching the muscle down to reestablish her breast pocket. I will then insert new implants and tighten the breast skin to give her a nice breast shape and contour. Okay, so if it's inadequate muscle release, we'll see muscle as soon as we go into the pocket. Boy, that's a really high pocket. What do you think that is?
Muscle.
Muscle. Well, let's see if it's inadequately released along the whole lower border. Bleeding a lot. That's because there's a lot of muscle down here. So, for sure, the muscle wasn't released enough, for sure. But there also is some scar tissue down here. Jennifer's complication of superiorly displaced high riding implants, unfortunately, is pretty clearly due to a surgical misadventure. The surgeon didn't release the muscle enough in the lower portion of the pocket, allowing the implant to sit in the proper position. All of that was holding up the implant. This. Okay, let's put the implant in. Let's see 585s. Not small, well, that's for sure. It's good, yeah. All right, okay, muscle release and some mild scar tissue removal. Now I have to figure out a way to tighten the overall breast envelope to get the mound and the pocket to be exactly aligned. He didn't release the muscle at all on this side. What did he do at that second operation anyway? All right, let's do the implant. Okay, check that out. There it is. That's where it needs to sit. That's where it should have sat. That's it. They're married again. I now pronounce you breast implant and breast. All right, so let's tighten this up and close her up.
Oh my God.
Hello.
Who got run over by a bus?
You ran me over.
I'm saying she's got that Xanax look or the pain pill look.
Are you having nausea?
Oh,
Bad.
so bad.
It's the pain pills. All right, let's take a look.
Your underarm looks normal.
Oh yeah, that looks good.
They're normal, booby.
They're normal. See this crease?
Sorry.
Isn't that good?
I thought I was gonna just have them horrible things forever.
No, these are good.
Thank you.
You're welcome.
I knew he would do a good job, but actually seeing my breasts look normal and like real boobs, it just, I don't even know how to describe it. I feel like I'm gonna throw up.
What? What's that?
I feel like I'm gonna throw up.
All right.
Here, give the trash can over there.
That one.
Right there.
That one.
Give it to her. It's okay.
Nothing worse than nausea.
I hate that.
I'm so excited to wear cute clothes again and just not worry about what people are gonna say or see when they see me. Oh my God.
I hate nausea.
So sorry. It's embarrassing.
Don't be sorry.
You threw up, though, very gracefully.
You have a gift. You are amazing at what you do. And you are too. If I ever need something done with my face.
After saying that, do you need to throw up again?
No.
All right, with that, let's leave her alone now.
After my divorce, I had hoped to start dating, but I was held back and stuck because I had breasts that looked like ciabatta rolls. They were not cute.
You're making it easy.
Wow, this is so beautiful
This
here.
is a good day to kayak, huh?
You excited?
Yes, I am.
First time you've been in an amazing swimsuit?
I'm excited to have a nice
Good.
swimsuit.
It's almost been 3 years and you haven't been in a swimsuit
I know.
you're comfortable in.
I love this suit. I
They
think
look
it
good.
looks so nice. Since my surgery, I can wear whatever I want. I can walk around with confidence. Simply having breasts on my chest where they're supposed to be, it's quite an empowering feeling to just look natural. It's not lost on me that I have received a true gift.
It's amazing they were even able to fix those nightmares.
I know. Even tops now, like, shirts and different things that before I would be like, oh my gosh, like, why bother? Now I'm trying things on and it's like everything looks cute.
And you can shave your underarms. I don't have to wax you last minute if you have to go somewhere. I mean, we could have braided that hair sometimes.
I know, that was horrible.
Since Jennifer's surgery, her whole demeanor has changed. These are the boobs that Jennifer deserved in the beginning.
Are we ready to get out there and try to kayak again, see if we don't drown or tip or...
We could get rescued by lifeguards.
I would be okay with that.
I'm sure you would with
And
those.
it's hopefully Jason Momoa. He could come save me. I've dabbled in some dating. I mean, I'm pretty proud of these breasts, so I would like to show them to somebody, but he's got to be very special.
I have 2 holes in my breast. It looks like a donut with a bite taken off and a hole in the middle. And the other one has a nipple that's going to the left. I have to insert gauze into my holes every day so I don't get infected. And it sucks looking at it.
I know that you said it's been healing, but
You want to see it?
No. Heck no. I have not. No. You've been completely depressed for 8 months.
Yeah.
Telling me that you can't look at yourself in the mirror.
I can't.
Why do I want to look at that?
In December of 2021, I decided I'm going to get my implants out. They looked really good, but they were so heavy. And now I am never, ever going to be the same. I'm a monster. It's like I can't even function.
I know. Well, the girls have been worried about you too, because they said that there are days that you just don't even get out of bed.
I can't. Because of the depression, I haven't worked. And honestly, if it wasn't for my mother, I mean, my girls and I'd probably be homeless. My poor kids. My girls look at me and they're like, we just want our mommy back. It sucks so bad. It's broken me.
Yeah.
I mean, if I could think of one word, it's broken. Because there's no way that I can go anymore looking like this,
Yeah.
Mom.
You know I'm 100% behind you. You know I love you so much.
Yo.
What's up, my brother?
We just got a referral from a plastic surgeon. Check this thing out. This patient who needs our help. Yeah.
I haven't seen that before.
Yeah.
That is a new one.
Yeah, so this is a patient who has had multiple previous breast surgeries. I don't know if these 2 wound pockets communicate, but this is an active, ongoing problem that is right now.
Okay, so a few questions. Number 1, is there currently an infection going on?
Exactly.
2, even if you can fix that, you've lost about a third of the tissue.
That's right. So
what's her name?
Her name is Tanna.
Can you please send in Tanna?
Tanna.
Hi.
Hi.
How are you?
How are you?
Nice to meet you. How are you? Hi, Tanna.
Hi, I'm
Hi, Tanna. Terry Dubrow. Pleasure to meet you.
Good to meet you.
Yes,
Yeah,
I
they
can see the
sure do look
resemblance.
alike.
Thank you.
So, Tanna, it's not very common that we see someone in the throes of the complication. Take us back to the beginning.
Okay, the first breast surgery was 1998,
Okay. So, what size did you put in initially? Do you remember?
550. About 2003, I meet my first husband. We took him out.
All right.
But in 2012, I had my second breast augmentation. 550, they were beautiful. Then, bam, divorce.
Yep.
You know, after divorce, you get a little chunkier.
Yeah.
Well, they just kept getting bigger and bigger.
It's too much.
Way too much. It was very painful. I mean, my fingers were starting to go numb. I mean, they were heavy.
So now you're developing functional problems.
Yeah, she's a nurse, so she's trying to
I'm a
move
ICU.
patients
You're
around.
an ICU nurse.
ICU. In the past, 3 years, ICU COVID nurse.
Really?
Yes, sir.
During the whole pandemic?
I ran it.
Really,
I
really
have
dangerous.
chills just thinking about it.
You must have been freaked out, huh? I mean, how did you get COVID? You got COVID, didn't you?
Twice.
Twice?
I got it from a patient that was intubated. And the only way for me to get to press on his chest was I had to straddle him.
Coded. Wow.
So I'm literally over him and his ET tube, everything's going in my face.
But what were you wearing on your face, though?
I was in a hole, I mean.
And you still got it?
Yeah, I was in
Her
my
own
own ICU.
You're kidding.
I've met a good amount of people that have been frontline workers that have taken care of patients with COVID, but Tanna, she tops it. That's almost like being in a war zone.
Okay, so 8 months ago or so, you had those 550s taken out.
Yeah. I had him done on December 22nd. 7 hours after surgery, I'm on the phone with him. Something's not right. I go, I am bleeding through my dressings. He's like, leave it alone.
And he didn't want to see you right away.
No, it started turning purple. He's like, trust the process.
He knew you were a nurse. He knew that you could identify
And I'm identifying.
problems and that there was a lot of bruising, which is probably indicative of reduced blood supply. When an ICU nurse tells you they're concerned about having a complication, you better listen because they are.
I did not see him until the 27th.
Wait. You had an explantation and lift, and you weren't seen for a week post-op?
Right.
You can get an impairment in blood supply, but the doctor has to immediately identify it and start treating it to minimize the damage.
Right.
You ignore it, it's just going to turn into black, dark, necrotic tissue and get infected.
So after the exam, the 27th, we bring her home, and she starts running fever. And
Yeah, the dead tissue is starting to get infected.
Okay, we're going to the ER.
At that time, around my nipple, it's black. And then where he did the lift, black. Underneath was black. That's when I woke up from surgery and I looked down and there's just this big hole. And I'm looking into my breast that will never, ever be the same ever again.
I can't imagine what that would be like to have to.
You haven't even seen it.
I won't look.
You haven't seen it?
Because I don't want her to see a reaction, and I would react.
Are you working?
No. Mainly because of depression. I'm literally living off my savings.
And dealing with this?
And dealing with this.
Okay. So if this maybe were fixed, you felt better, is that something you want to do, go back to work?
Oh, yeah.
It's her calling.
Yeah. All right, well, we can relate. You're a hero.
Thank you.
And we appreciate you.
Will you be my hero?
I'm going to try. You ready for this?
I don't know if I'm ready for this, but.
Sorry, Mom. All right.
Let's see what's going on here.
Oh, you ready?
Yeah.
And I'm still just doing wet to dry.
Oh my God.
This is what I have to look at every day.
Oh, that's hard to deal with. I can imagine why you were depressed. I now know why she cries when she looks in the mirror. It is really disturbing. It broke my heart.
So let's see how deep it is right now. So this goes, tell me if I'm hurting you and I'll stop, okay? I have to figure out the extent and depth of Tanna's holes. Hopefully, if they only go a short distance, I can just remove them. But if they go all the way to the depths of the breast tissue, that could be lined with bacteria and could ultimately lead to a significant infection. Okay, that one's good. That one's minimal. What about this one? This one's done too. These are done. This breast is ready to do something, theoretically. The question is what to do. So if you think about it in terms of symmetry, which one sets the bar? This one, because this one is, we're not going to make this any bigger. We're not going to put an implant in. If we did, it would be a disaster. So if we can get this well-shaped, it'll be a small C.
I'll be happy.
The question is, can we do that safely without compromising blood flow? Because we know we have a reduction in blood flow. And then can we match this one to that one? In other words, can we reduce this without killing it? At first blush, it may seem like the right breast is much more complicated than the left breast, but actually, the holes in the right breast aren't very deep, so I can excise those easily. The left breast reduction is much more complicated because I've got to reduce large chunks of breast tissue with severely reduced blood supply from the previous scarring.
Can we do it tomorrow?
Okay.
Yes,
all right.
please. It's been a long time that we've had some hope.
Cautiously optimistic. It's like the first time he was intimate with his wife. She took a look at him and she said, "Well, I'm cautiously optimistic that it's not as bad as I'm thinking it's gonna look."
Here we go. Okay, come on. Let 'em know it's about to be on, yeah.
How are you feeling?
It's going to be very hard for me to walk those stairs.
You're going to be in the best hands in the world.
The last time I had to do this, I left and this happened. You know, I know it's not going to happen again, but it's just scary.
Tanna, a true hero.
Yeah?
ICU COVID nurse.
Oh, wow.
I want to get you back doing what you do. As you can see, we have got a significant asymmetry. So the whole point is this one sets the bar.
Yeah.
This breast.
Yeah.
If this were an implant, this would be about 450, would it not?
Yes.
I think so.
Yes.
Do we have 450? Could you grab one? Big part of estimating.
That's 445.
All right. Feel that. Come here. Put your hands around that. Cup this.
Yeah, okay, yeah.
All right. Do you have a bigger one? All right. Do you have a 650?
Yeah.
So.
Yeah, that's, yeah, yes. I don't think it would be more than that.
Yeah, I think so. Maybe this is about 200 reduction. My goal is to start measuring the various geometric dimensions of this breast and then apply that to this site. So it's like a geometry test, okay?
Well, I hope you did quite well in geometry. Just throwing it out there.
For Tanna's surgery, I will begin by opening up her right breast and releasing the scarred down tissue. Next, I'll perform an anchor lift through her old incisions to remove the 2 wound pockets, rearrange the tissue to give her shape, and then stitch together skin to resemble a nipple. Then, I'll remove tissue from the left breast until it matches the right breast in both size and shape. After Tanna heals, we will give her a 3D areolar tattoo. Okay, since the right side sets the bar, let's start on the right first. Start by opening up the center portion. The key with this breast is to release the scar tissue as much as possible to try to be able to fold things up and give it a good shape, but not further reduce the blood supply so that the breast tissue dies. All right, let's see what kind of shape we can get. That could be a really full breast if we can keep this alive. What do we think of this?
Kind of like it.
It's kind of a nipple.
Totally.
And then we'll tattoo around here.
Yep.
All right, now that we have the right breast made, let's see what we can do with the left breast to see if we can match it. Here comes the tricky part. All right, here we go. I've estimated that I need to remove about 200 cc's of tissue from Tanna's left breast to make it look like the right. The problem is, the more tissue that I remove, you may rob the blood supply and oxygen supply to the lower part of the breast, and the whole breast may die or fall apart postoperatively. I need about 200 grams of tissue. Here.
Just to add this. 52?
52?
Yeah. That's it?
Okay.
$145.
The more I take, the less blood supply I'm leaving. The greater the risk of injuring this breast. Man, this is a hard case. Can I have a handheld liposuction cannula?
Yeah.
So far, I've removed 145 cc's of tissue from Tanna's left breast. Unfortunately, I have about 55 cc's more to increase the symmetry with the right breast. I'm concerned that if I reduce any more by excision, I'll overwhelm the blood supply. So I'm going to use liposuction to do the final further icing on the cake reduction, which allows you to remove more breast tissue. The nipple's alive. We've achieved symmetry. We've got good shape in both. I made her a little nipple. Little cute nipple. Let's get this girl back in the ICU, but not as a patient.
Right.
As a nurse.
Big difference.
All right, let's close. Awesome.
How you feeling?
A lot better than I did yesterday, that's for sure.
Really?
Yeah.
The right breast came together in kind of a nice, full way, much bigger than I thought it was going to be. There was a little bit of extra tissue that I kind of brought together. Maybe I made a little nipple, because then we could tattoo the areola. So let's take a look.
Oh my gosh. Oh my gosh.
Oh my goodness.
Ooh, that pink.
I just remember when I saw them
Pretty
for
cool,
the
right?
first time.
Pretty cool.
I just want to hug both of you. I'm just amazed.
Dr. Dubrow did not bring Tanna back. Dr. Dubrow brought Super Tanna back.
That's amazing.
Cool, right?
Oh my God, I want to hug you.
amazing.
Oh, I can finally cry tears of joy.
Right?
Oh my God. This is exactly what I wanted. They're perfect.
Let's just keep a close eye on everything. Anything changes, you let us know immediately. Don't call us, come in. We will see you, okay?
Okay.
I promise you. So far, so good. Well, hello.
Hi.
How are you? Good to see you
to
again.
see you.
Tanna, how are you? Good to see you. This, ladies and gentlemen, is Jason. We brought Jason here for a specific reason, to finish the journey.
It's been a long road, and I am ready to have my life back. I no longer see a monster, just two beautiful breasts.
Isn't it amazing? It actually
No, it does. It looks three-dimensional.
Three-dimensional.
That's called art.
We're good to go.
Wow. This tattoo looks identical to the one that's really there. My breasts are symmetrical. I now have two areolas, and I think they're just beautiful.
You've always got away with me, even though I try to run from your love.
Before my surgery with Dr. Dubrow, my right breast had 2 holes in it, looked like a donut, and it made me feel like a monster. And I was so depressed, I didn't even want to go to work. But now, thanks to Dr. Dubrow, the holes are gone, and I have 2 matching breasts. My depression is lifting, and now I can go back doing the job that I love the most, being a nurse.
You can look in the mirror.
I can look in the mirror, and I'm like, there's your beautiful self again.
Well, baby girl, I look forward to everything in the future for you.
I'm excited for a new work position. I'm excited to do new things with my kids. I'm excited to hopefully find some type of relationship. Can't wait to get fucked. No, I'm just kidding. Sorry. I'm back. I'm back on top.